लाईट लाईट त्यांच्या चेहऱ्यावर, त्या खुर्चीवर.
A warm good morning to all the respected professors. A warm good morning to all respected professors, eminent speakers, associate professor, assistant professors, researchers, students, and ladies and gentlemen present in the hall. Myself, Dr. Shilpa Revre, Assistant Professor, Rachna Shalia Department, Ayurveda Mahavidyalaya. As a day in charge, welcome you all in offline third day of 4th National Conference on Evidence-Based Ayurveda, organized by Ayurveda Teacher Association and accredited by Maharashtra University of Health Sciences, Nashik.
Good morning. Myself, Dr. Praveen Bhatt, working as an associate professor at Sumati Varisha Ayurveda Mahavidyalaya, Department of Shalakatantra. I welcome you all. It is my pleasure to welcome all the participants today at the 3-day 4th National Conference of Ayurveda Teachers Association with the theme Evidence-Based Medicine in Ayurveda. A warm welcome to all of you.
Ayurveda Teacher Association India is an organization established by the teacher for the all-round development of the teachers. Through this organization, which has network across India, an intellectual feast is organized through the National Conference for all those working in the academic and practical fields of Ayurveda.
This is the first conference in the history of Ayurveda, which is conducted in hybrid mode. That is, for 2 days, this conference was conducted as an online mode on Zoom platform, while today is an offline mode and third day of the fourth annual national conference with a feast of knowledge. We are proud to announce that this conference is being conducted along with cooperation and accreditation by Maharashtra University of Health Sciences, whose support to Ayurveda Teachers Association national conferences is consistent. The main outcome of this conference is to come up with a national and international framework for the Ayurveda education as an evidence-based medicine in Ayurveda. We hope that this 3-day conference will expand the mental horizon and help out Ayurvedic education system to adopt the best of the outcome from conference. I request all the teachers and participants to make use of these 3 days to the best of their abilities.
In today's live visit, we are going to listen to the reflections of renowned experts in the field of Ayurveda from all over the India. These experts have spent years of their life on this subject. So it is a golden opportunity for all of us to hear the essence of their many years of hard work and devotion in every scientific session from now onwards. So without much delay, let us begin today's session by remembering the virtues of Arogya Devata Shri Dhanvantari and taking his blessings. We shall start the morning session lectures on time. The topic of our scientific session is experience of Ayurveda management for cancer care and institutional approach. And to host this first scientific session, I would like to invite the session coordinator, Dr. Aishwarya Ranade, MD PhD, working as assistant professor in the Department of Rog Nidan Vikruti Vignan at Kirak Ayurveda College, Pune. I request Madam to please come on the stage and take the charge of this first scientific session.
Thank you very much, Madam. A very good morning to one and all, and a warm welcome in first scientific session of the seminar. The title of this first session is Experience of Ayurveda Management for Cancer Care and Institutional Approach, and honorable guest speaker for this session, Dr. Pankaj Vanzar Khedkar. To start with the session, I would like to invite Dr. Vijay Ukhalkar as chairperson of the session. I invite him on the dais. Dr. Vijay Ukhalkar, his academic achievements are BMS, MS, PhD. He is specialized in Shalyatantra and super specialty is in anorectal surgeries in Ayurveda. Being a PG and PhD guide in MEHS, his academic achievements also include O-level business proposal programmer in IT, PC, software business system, C language, and executive MBA in IT and HR, along with certificate course in biomedical instrumentation and yoga pravesh. Currently, Dr. Ukhalkar is working as professor and HOD, Department of Shalyatantra, Government Ayurveda College, Nanded, Maharashtra. He has research articles published in various international and national peer-reviewed journals. He has worked as investigator in various research projects sponsored by Government of India. For his skills in his specialization, he is being called for guest lectures in various reputed scientific gatherings and reorientation programs. He is esteemed author of 3 textbooks based on the subject Shalyatantra and Agnikarma in Ayurveda, and has contributed as author for chapter in textbook sponsored by CCRAS. In Maharashtra University of Health Sciences, Nashik, he is ex-member of Board of Examination, ex-member of Academic Board of Studies for Certificate and Fellowship Courses and Ayurveda and Hinani, ex-BOS member for PG Board, ex-member of PGTRC Committee, and has worked as a member in various other committees in NHS. His exclusive interest in programming and website development led to a great contribution in developing websites of Ariputta Government Ayurveda Medical College and Government Ayurveda College, Nanded. Also, he has contributed in software development in various state directorate Ayush related softwares and websites. He has many awards under his name, to name with Gunvanta Adhikari va Karmachari Gaurav Puraskar 2008 by Medical Education and Drug Department, Government of Maharashtra, Dhanvantari Paritoshik 1998, Honorable Minister Shri Shankarraoji Chairman Gunvanta Paritoshik by Nanded Municipal Corporation. I heartily welcome you, sir, as a chairperson of the session. I would like to invite on the dais Dr. Kamlakar Gazre as co-chairman of the session. Dr. Gazre is MS PhD in Shalyatantra. He has done diploma in laparoscopy from Indian Institute of Laparoscopic Surgery, Coimbatore. Currently, he is working as associate professor in Srimati Sumati Bai Shah Ayurveda Mahavidyalaya, Hadapsar, Pune. He is practicing consulting surgeon at Nirame Hospital, Pune since last 20 years. A PG guide in MEHS, he has completed 8 sponsored clinical trials as principal investigator. He led Sami Guruji Arogya Mandir, Hadapsar, Pune. I welcome you, sir. I invite today's guest speaker, Dr. Pankaj Vanzar Khedkar, on the dais. To introduce our guest speaker, I invite Dr. Kamlakar Gazre.
Welcome, sir. Very good morning. It is my privilege to introduce today's guest speaker. His topic is very relevant with today's theme of our workshop, that is evidence-based Ayurveda, because he is practicing physician at Dinana. I will give a brief introduction of Dr. Pankaj Vanzar Khedkar. Sir has postgraduated from Nanded Government College. He has postgraduate proficiency in Panchakarma from University of Pune. Presently, he is working as an honorary consultant of Ayurveda at Dinanath Mangeshkar Hospital, Pune. He is also working with Sahyadri Hospital, Kothur, Pune. He is working with Vivekananda Hospital and Cancer Center at Latur. He is a member of Research Steering Committee MEHS Nashik. He has been invited as a faculty for medical practitioner at Peru, South America, organized by Ministry of External Affairs, Government of India. He's also been invited as a faculty in University of South Florida, University of Wisconsin, Health for presentation of clinical data on scope of Ayurveda in head and neck cancers. He has published his research articles, 6 research articles in various national and international journals. He is principal investigator on ongoing research project on cancer at Dinanath Hospital. One of them is clinical study on application of Ayurvedic principles in chemotoxicity in ovarian cancer. He has been principal investigator at randomized control trial on radiation-induced mucositis in oral cancer. His third clinical trial is Ayurveda interventional clinical study on chemotherapy-induced nausea and vomiting. So with this brief introduction, I ask sir to present his lecture. Thank you very much.
Namaste. With kind permission of chair and co-chair, thank you very much for inviting me over here. I thank the organizing committee of and the whole office bearers of Ayurveda Teachers Association, and a very warm Independence Day wishes to all of you. So I said, this is the appropriate thing that I'm blessed being Indian, Bharatiya. At the same time, I would like to add, I'm blessed to be in the field of Ayurveda, which is Indian system of medicine, on this 75th Independence Day. So actually, when organizers first called me, they are like, we are working for a conference with some evidence-based in Ayurveda. So because I'm working with some multi-specialty hospitals, and those are the mainstream hospitals. So the word evidence has a lot more to do, and I don't know how we can incorporate the word, particularly evidence, without a significant number of publications. And that is not from one or two institutions across the India or across the world, but that should be from multiple institutes. So we need to have a network of institution, and I'm really happy to be here, because here I came to know that almost all Ayurveda teachers from various parts of India are representing on participating in this conference. So maybe down the line, 3 or 5 years, we will really have that kind of evidence, which is recognized as evidence in any system of medicine, not only Indian system of medicine. So with the permission of organizers, I just revised it from evidence to experience, because these are my experiences. Maybe we are doing some work to generate evidences, but these are preliminary my experiences. So this is a disclaimer, basically. Whatever methods we adopted to practice since last 10 years, I cannot say that those methods are universally accepted, but because there were no methods which were universally accepted, so we started with whatever we can do our best. Then we do not insist that any correlation. For example, there are a lot of things which, when it comes to academics, we have to find out some correlation, that is Arbuda and cancer or so. So we are not here to insist on anything. So that is basically the definition or the nomenclature of the disease is the domain of the academic experts over here. So we are not, we never insist for whatever we are talking about. And the presentation is to convey that how we are facing the challenges, and how so far we have done in this field, which is actually a non-mainstream medicine, but definitely it is Indian system of medicine. So I respect all that. Everyone is basically from academic background over here. So lesson number one, what I learned is I should discuss only facts and no myths or nothing extrapolation. Whatever is there is the first-hand evidence or the facts what we have experienced in last few years. So the fact check, where do we stand today in the field of cancer care? So I mean, there are some individuals working with this. There are some institutions which are working for cancer. But as a fraternity of Ayurveda, or as the Indian system of Ayurveda, where do we stand as a fact in cancer care today? The answer is unfortunately nowhere, because there are hardly any significant, what is the theme of conferences? Evidence-based. So if we really want to find out evidence, level 1 evidence, level 2 evidence, we are yet to reach level 4 or level 3 also. So the answer is this. So let's start with this, that we stand nowhere as on today. So what is the present scenario? That we have varied diagnosis of cancer. Everyone as per their expertise, as per their intellectual analysis of the samhitas, text and all, they keep on doing different kinds of diagnosis when it comes to it. Second is line of treatment. People may start with Shodhan Shaman or Shaman Purva Shodhan and Rasayana treatment, or many other domains which are being discussed or practiced across India. Then priority is always towards the ready remedies, because you know, if you just go through the routine treatment of cancer, a lot of things are happening for the cancer patient at the same time for the family members also. So nobody is keenly interested for conducting daily the preparation of Shirpak at household and then coming to hospital or going for the treatment. So that is one part. Then diversified thinking of cancer is there as far as Ayurvedic concern. So it can be correlated with at the level of dosha, dhatu, mala, or many other concepts in Ayurveda. So there are some learnings and experiences. So learnings are what was the first learning when we started 10 years back? First was the lack of, or the challenge of, uniform diagnosis. So what should be the uniform diagnosis for every cancer disease condition? It is yet unresolved. So I may need, or I may request all the teachers over here, that is offline and online mode, that if they can really contribute for uniform diagnosis. So far, being we are keeping all diagnosis same as they were mentioned in conventional system of medicine. Second is challenges with the definitive studies. Definitive studies means that is 1 + 1 = 2 kind of thing. That mathematics doesn't apply to medicine, but that is the challenge. The knowledge about the drug selection and interactions. This is where the support from mainstream medicine is lacking, because at times we do not discuss with the drug interactions, or we do not discuss with the drug selection. That is the first thing which was a challenge for us. Then what are the safety assessment? So we have a lot of safety trial data about almost every herb, maybe by Ayurvedic postgraduate or PhD students, or from the M.Pharm or this PhD in biotechnology students. So there are a lot of safety data. There is a lot of efficacy data, but unfortunately, it is all in bio. Clinical data for safety or clinical data for efficacy assessment is really lacking as evidence. I'm talking about that it is not just about a publication or two, it is about level 2, level 3, or level 1 evidence. Level 1 evidence is a distant goal for us as on today, but definitely we can aspire for level 3 or level 2 evidences. Then challenge for the clinical guidelines. We have limited clinical guidelines when we talk about diseases like cancer. Then challenges of the index publications. Index publications is another challenge. We were just talking in the morning with our honorary chairperson that publications and the referencing is also a challenge for us. Then challenges to be open for critical reviews. We are not open for critical reviews when we discuss any kind of cases. So that is another thing. And the scientific attitude to agree to disagree. That is more important. Whatever we are sharing over here, it is open for agree to disagree. So let us start with what we have done so far. So similarly, these are the experiences, what are the understanding and how we can go ahead. So let us start with understanding the categories of treatment, how we categorized to start with, and then we will just discuss one by one. So institutional cancer care, mostly it is correlated with the prevention or preventive aspects, but there is a prevention. Diagnosis is what I told, that is a uniformity in the diagnosis or uniformity in the terminology is lacking. So that is the thing, that at diagnosis we are on red mark so far. Then pre-surgery or neoadjuvant treatments. In surgery, again, red mark for us, we are not doing a lot into the surgery and surgery related thing. Post-surgery, yes. And rest of the thing like adjuvant treatment, maintenance, recurrence, relapse, palliative, supportive, and up to certain extent end of life treatment. So these are our areas so far identified across the nation. We are challenging or discussing with these issues only. So main focus of our treatment goes from prevention to end of life, except the two things, that is diagnostic part and surgery part, because at times we have to be very critically open for concluding on what the diagnosis should be or what the invasive procedures should be. So present role is to promote a treatment schedule. We don't propose treatment schedules for particular type of cancer. So we have to identify the group of cancers and then go ahead with the treatment schedule, because one schedule cannot be applied for all cancers. That's the limitation. Then to maximize the care quality, this is what we are going to discuss in short while. For palliative care, obviously, yes. And to guide the end of life arrangements. Now there is a dilemma, because end of life arrangement, at some point of time, you have to be very clear for cancer patients that no treatment is going to help you. Otherwise, there is a principle that yavat kantagate prana tavat chikita. So we have to be very clear on what should be our stand for end of life care. So this is again a thing to be discussed or to be taken for further analysis. So magnitude of the problem, if we grossly see, this is Maharashtra scenario, that tobacco consumption, either at chewing tobacco or smoking tobacco, will account for 50% of cancer in men. But the dietary practices and reproductive or sexual practices, that IVF and all, so those are accounting for 20 to 30%. So dietary practices is a strong point of Ayurvedic medicine, that the way we think about diet, the way we practice the diet in our practice. So that is the most important area where we can presently focus on, because de-addiction and for tobacco smoking is again going to be the subjective goal, but definitely dietary practices. And as far as our experiences is concerned, people really expect from us to give a precise diet, whatever your principles may be, that they don't bother that whether you are prescribing diet from as per avastha, as per agni or whatever, but they are expecting something which is more than the calorie value of your diet, that is more than protein, carbohydrate or minerals. But they really want that is, and definitely dietary practices, if improve, then there are certain things which really give a good outcome in a cancer patient. So this is what is prevention. So nowadays, these kind of patients with just dysplasia, not defined or not confirmed malignancy in on histopathology or cytology, they reach to your clinics because they have some doubt about, because they are chronic tobacco chewers or gutka chewers, and they will come. So for these patients, if you can really offer something, that is the best prevention, that is first, that is primary prevention, where you can definitely work for. So this is how the things are. So it is clear dysplasia, and now this is being recovered cytologically confirmed diagnosis. So this is how the role of prevention, definitely we can work and go ahead, just a precancerous condition. So similar things can be applied for very other cancers. I'm just giving some experiences over here. Now, can we integrate actually? So, for example, say, let us take example of prostate cancer. What we have in Ayurveda, the references like Mutra Roga, we have then Paushvanti and Vanashila. We have all these patients. But can we add to what is known or existing? That is something kind of TNM classification. I'm not saying that TNM only should be applied, but we don't have anything except TNM today to apply. So we either apply TNM or HSAC as of now. But can we work on this kind of thing? Because this is really should come from the academics. I will just go through few of the staging, then how it matters how the outcome or prognosis can change. For example, this is the if we just follow this integration for the diagnosis. So if you see the prostate cancer in early stage, that is stage 1, this is very early to be picked up, but it is a challenge to pick up this at this level. But still, this is quite a good identification of disease at this stage. So if we can just go through, if you see or the progress, how the disease progresses up to this level also, even just the ADT or just orchidectomy, that can be helpful, and then you can take the patient with Ayurvedic management for next year. So we have some cases, the post-orchidectomy lifespan without any other treatment, then no radiation, no chemotherapy, it is more than 8 years, 9 years. A few patients are going to get 10 years also. But then you have to pick up the disease at the earliest stages. Then this is stage 3. Then again, this is metastatic stage 4. Then you have limited scope. So whether we can identify such kind of classification apart from what is known to us, and if we can practice it. Now, whatever we are practicing, it is just integration. That is some staging, some imaging or histopathology things are borrowed from modern medicine. We are incorporating in the system, and according to as per the stage, we are planning certain treatments. But whether we can identify certain staging system for ourselves, which should be validated system, obviously, and evidence-based. Then post-surgery management, that is one. Again, we have trial this for the head and neck cancers mainly to improvise the general condition, to maintain or to improve the nutrition post-surgery, and then go for further treatments if applicable to that. But there is a good set of a good set of people who are not eligible for chemotherapy for some medical reasons. For example, if a patient is having already chronic kidney disease also, so the chemotherapy has some limitations. Or there are some patients who do not want to go ahead with chemotherapy, though we counsel them, we obviously give pros and cons for chemotherapy. Still, there are some patients, so they by choice opt for these kind of treatments. Then post-op, that renal cell carcinoma, parotid tumors are observations under observations for more than 5-7 years so far. So institutional cancer care. So this is the post during radiation, that is at radiation skin reaction. This is radiation induced dermatitis at 25th radiation. And if you see that is post-radiation 10 day, the recovery with the local applications only. So this is the strength of Ayurveda where we can just go with the local applications. Now, this is an interesting case. If you see the tracheostomy already done, you see the grade 3, grade 4 radiation induced dermatitis reaction. Now, young patient at 18th radiation, the radiation was put on hold because of the severity of reaction. So obviously we started with local applications only, and in 4 days recovery, we could complete his radiation at with this recovery after 4 days, and then the patient is having good survival till now. Now this is like 5 years plus. So this kind of treatments, which are very basic treatments and which can give significant contribution for the patient's health. It is not necessary to just think over that what we have contributed, but how much we can contribute, that is more important. Whether it is a topical treatment, whether it is a systemic treatment, whether the type of treatment is immaterial. What is important is how early the patient can get the proper treatment, and then patient should be in remission, because cancer is the only thing where the time is very important. Because if you just miss on the time, given a chance, if this patient would have defaulted for radiation after 18 fraction out of 35, then it would have been a recurrence for that patient. So this is how we can contribute definitely, and that is the way we should create our experiences or the evidences. Now, if you see the 1 month post RD, you can see the mouth opening, and this is just 1 month addition of the local, the Kavala only. Okay, so this is the difference how you can improvise the trismus. This is again another example of grade 3 radiation dermatitis. Now, this lady has already, that is what I discussed, that dietary practices we have to, or dietary advice is more important for nutritional maintenance of the patient. So those patients who undergo usually radiation or chemotherapy, diet is very important. If the patient is having a proper nutrition guideline, then the rate of reactions or rate of the tolerance of radiation and chemotherapy is far better than what we expect. So if you can just see this grade 3 radiation reaction, again, same thing, put on hold for radiation. If you see the rapid healing of the epithelial whatever, so this is just within a week's time. So these are a few of the examples where we can definitely go ahead with Ayurvedic management integrating with the thing. Then we are obviously working for side effect profiling also. So that is chemotherapy, nausea and vomiting are the known factors for many of the chemotherapy agents. So yeah, we have developed a protocol where we generally start with Ayurvedic medication prior to chemotherapy. So when a patient is scheduled for chemotherapy, before that, for 5 days, we start with the medicine so that it will be better. And we have seen that even with the high imitogenic group of chemotherapeutic drugs, our patients do well with the scale of nausea and vomiting, that is CINV chemotherapy induced nausea and vomiting. Similarly, with the radiotherapy, that diarrhea is one of the GI radiation, pelvic RT particularly, then submucous fibrosis, oral cavity, oral mucositis, then that is skin, whatever you are seeing, just skin dermatitis, and then hair loss and prevention of the other, like for breast radiation, then if we can just prevent the lung fibrosis and all other things. So we started with this oral mucositis study, and it was just for the Kavala and Gandush, nothing else. So when we started with that, then we saw a significant reduction in the rate of oral mucositis. But what happened is when we completed the study, it was a formal study actually, case control study. When we completed study, we presented, and then because that is the first slide what I showed, that we are agreed to be disagree. So when we presented that work in mainstream oncology conferences, so the question came that, okay, Ayurvedic medicine or Ayurvedic intervention with radiation, they are reducing the toxicity of acute toxicity of radiation, but what are the chances that reduction in acute toxicity can cause less efficacy also? So whether you have tested this. So with that, we conducted a full 3.5 year study, and we concluded that those patients who received the Ayurvedic intervention, that in the form of Gandush and Kavala for reducing radiation mucositis, at the end of follow-up of 3.5 years, the efficacy is well preserved and there was no additional recurrences noted as compared to the control group. And this was published in the mainstream journal, South Asian Journal of Cancer. So this is what we are trying to create some of the evidences, and that's why I'm here. So this after this study, now this was a case control. So this is again evidence level number 4. So again, there were demand from the oncology network and few of the radiation oncologists working in our hospital and a couple of more hospitals. We just happened to discuss this thing with them. So we are now almost completed the randomized control trial of the same study, and maybe we are analyzing data shortly, and the randomized control trial with level 2 evidence will be published maybe by end of next year. So this is how we are gradually generating a few of the evidences. Then scope of Ayurveda for add-on Ayurvedic treatment in locally advanced diseases. So local diseases versus morbid surgery, this is at times thing to take a call. So now this is whatever we have done, this is in consensus with the team of oncology in our hospital. It is not only Ayurveda department which is conducting these kind of things. So now this is a typical presentation, unknown primary with meta study. So this is the presentation. So the post ready because patient was inoperable because the surgery would have been very morbid. This fellow is a porter, so he opted that I will not go for surgery, but I will just continue with the treatments. So after 2 weeks of radiation, you can see the wound, and now what is the probability of developing orocutaneous fistula? So these patients that develop fistula if the wound wouldn't heal early. So we added with some of the Ayurvedic interventions, and then you can see the gradual reduction in the lesions, and this is after 14 weeks. So these kind of patients where it is locally advanced disease. So we have to find out whether what is the goal of treatment. So one is high risk and another is secondary prevention. So far we are doing that high risk prevention, that is patients with the breast pain, particularly family history of CA breast. We are providing them upfront prevention, then BRCA1 mutations, and secondary prevention for ovarian cancer, head neck squamous cell carcinomas, and mucinous adenocolon cancers. So these are the areas where we are presently giving this maintenance treatment for after standard of care. That is also one of the important thing. Then this is one standalone Ayurveda maintenance treatment. If you can see the results over here, that whatever medicines we prescribe now, first case, this first lady is, she had 3 earlier recurrences of ovarian cancer, and we could give that progression-free survival of 28 months after 3rd recurrence. And this is the first one. This lady has 1 recurrence, but there is no recurrence till 45 months, and still by this time she has completed 52 weeks. So this study is published again in mainstream oncology journal, Indian Journal of Medical and Pediatric Oncology. So this is the way we are just creating the experiences into some of the evidences. Definitely these are again level 4 evidences, but these kind of studies or these kind of observations, persistence, that is more important, because to follow a patient over 52 weeks, almost 5 years. So we have to be in continuous follow-up with the primary oncologist as well as the patient, so that we at least gather this kind of data. So this is another evidence what we have. Then maintenance treatment, this is a post-surgery. Now this is the CA esophagus recurred case. Even after recurrence in CA esophagus, we could give that progression-free survival 3+ years so far. Similarly, the palliative treatment, metastatic CA breast, if you see the extensive vertebral metastasis and severity of pain even after 3 lines of chemotherapy. So the goal is only overall survival, and there is no other goal. So we just add a few of the Ayurvedic treatments for these palliative patients. Then this is metastatic colon cancer with hepatic metastasis. The thing is that this patient with hepatic metastasis, that was a solo lesion, but that lesion was with the hepatic artery. So no further treatment was advised. That is, radiation cannot be done, surgery is out of question in view of age and all. So obviously the plan was oral chemotherapy plus Ayurvedic treatment. Now, everything is again documented in consultation with the multidisciplinary tumor board of, and then we got this overall survival of 4 months and 4 years and 7 months. So during this treatments, whatever treatment we plan for cancer with Ayurvedic interventions, at times we used to use some kshar, some bhallatak, or these kind of drugs which are actually having serious side effects also. So we do accept that we do have these kind of side effects or reactions up to certain extent. So this is one of the patient, CA nasopharynx, who was on Balladakshir, and on day 21, she had this kind of reaction. So own reactions, it is not like disown reaction. The Ayurvedic medicine doesn't have any reaction. No, we never say those things. We own the reactions, we treat those, and this is just 3 days post-reaction. That just hold the medicine, wait for the physiological recovery, and then you can just go ahead with this. In spite of these things, right from prevention or maintenance treatment or locally advanced treatment, palliative treatment, or this kind of reaction management, still we have limitations. So these are the limitations. We couldn't do anything in few of the patients. This is one of the local recurrence on advanced head and neck cancer. So nothing worked in this patient. Again, this is that what I mentioned in earlier slide, that cancer is always a time sensitive disease. So again, these kind of patients who develop cross oral cutaneous fistulas, we couldn't do anything in spite of trying multiple local applications. Or so this is the thing. This is what can happen to the one patient, what we have seen with early intervention. So these are the things where we couldn't do anything. So these are again the limitations of so far whatever regimes we are using. So if there are any suggestions or clinical inputs or clinical observations for these kind of patients, we welcome from all the respected teachers from across India. So goal of the institutional care is first is symbiotic care, that is add-on benefit to the patient for better survival, better outcome, disease-free survival, the first goal, progression-free survival the next, and overall survival is depending upon the type of cancer and type of care we are providing. Complementary care, obviously side effect providing what we say. Then avoid to contradict, because there are certain drugs which are very aggressive. So we have to find out whether we can complement or contradict. Wherever there is contradict, stop a while, take a pause, and then add Ayurvedic medicine at proper time, because anxious addition of Ayurvedic medicines at times may lead to some kind of contradiction. So it is better then placement of Ayurvedic medicine is more important than replacement of modern medicines, because at times approach of patients are like asking for replacement. Can you replace our chemotherapy? We don't have that level of evidence as on today to replace the standard of care. So it is better to think over placement of Ayurvedic the system of medicine in the mainstream cancer care, rather than thinking or rather than catering the demand by patients to replace the same. So can we stand in cancer care somewhere? We started with where do we stand? The answer was nowhere, because that was the fact. But if the all teachers offline and online who are participating, if they decide and they support this, then we can definitely convert that nowhere to now here, because the way we think that can be produced. So this is my humble appeal to all the teachers to just support us, because you are there everywhere. You are there in every district. You are there in with the team of students in your hand. You are there in board of studies. You are there. I mean, you are everywhere. So if you decide at some point that one student of every PG batch across India can come up for the study in cancer at various levels, depending upon your topics and depending upon the subjects of expertise. So we can, I think, make this that nowhere to now here. So that is the thing. And thank you for inviting and giving this opportunity to deliver our experiences. So there are challenges for everyone. So if you think just that 1982, what we have in cryogenic engine and where we are, so similarly, the team, if we decide, then we can definitely have the solutions. To conclude, I will like to acknowledge our hospital team, that is oncology team of Dinanath Mangeshkar Hospital, Pune, and oncology team of Vivekanand Hospital and Cancer Center, Latur, for giving this platform to Ayurveda to develop these kind of experiences over last 10 years. Thank you very much.
If there are any questions regarding the session, if anybody is interested, then questions are invited. Sir, वर येऊ शकता?
Yes, those are definitely of importance. We should continue that stream also, but that is one of the stream. That is not the only thing, because if I mistake not, since last 20 plus years, we are more into in vitro, in bio studies, and nowadays these cell line studies. Definitely, it has its own merits and it supports a lot. But the thing is, this is the clinical evidences at the same time we should encourage, so that we will be at certain level at the end of maybe, if we put a goal of 5 years, then it will be more important to have at least level 3, level 4 clinical trials or clinical evidences. Along with this, obviously, in bio and cell line studies. Obviously, that is important. That is the research tool.
Because at the time of cell line study, we get a very good and best result. But when we come up with patient, I think we find
it always
some-
differs.
yeah.
It always differs. Yes.
Thank you.
I request Chairman Dr. Vijay Ukhalkar sir to give his expert comments on the session.
First of all, I am very thankful to ATA and organizers, MHS, all the dignitaries on the dais and off the dais, my gurus, to be here in a such beautiful and scientific session as a chairman. I would like to congratulate Dr. Pankaj that he shared his experiences, not only the experiences in a scientific way, what he has, the experiences, he presented it in a scientific way. And it is a feast for teachers to carry it forward. And what are the requirement in this area? This is the potential area and the requirement of this human society, that this field of malignancy, you should work to improve the quality of life, the main treatment source and prevention. And the Dr. Pankaj has given has taken the initiative very nicely. And again, I would like to congratulate Dr. Pankaj. Thank you very much.
Thank you, sir. Thank you, our guest speaker, Dr. Pankaj Vanzarkhedkar, for an insightful lecture. It is a need of time to work hand in hand to promote and execute interdisciplinary and transdisciplinary approaches in every aspect of the disease, in any or every type of disease. I wish your work in collaboration with such a renowned multidisciplinary hospital in the field of cancer which still needs a greater attention in terms of patient care, shall bring out more and more fruitful and successful results. May your work not only endure a patient's quality of life but also explore the horizons of Ayurveda in multiple dimensions. I'm sure your endeavors in the field of cancer in terms of Ayurveda shall definitely motivate new Ayurveda seekers. Thank you so much, sir. I request Dr. Sangram Das, um, General President ATA from Goa, to felicitate our guest speaker, Dr. Pankaj Vanzar-Khedkar, sir. Thank you, Dr. Das. I request Dr. Kamlakar Gazde to felicitate our chairperson of the session, Dr. Vijay Ukhalkar, sir, with a token of appreciation and token of love. I request Dr. Manoj Chaudhary, sir, Secretary ATA National General Committee, to felicitate Dr. Kamlakar Gazre, sir. Dr. Manoj Chaudhary, sir. Thank you very much, sir. Today we have a special guest with us in the auditorium, Dr. Dr. Venkat Dharmadhikari, Assistant Director of Ayurveda, Pune region. Sir is known for his immense enthusiasm, his extraordinary command on Sanskrit language oratory, and his phenomenal dedication towards his work. He is a well-known Ayurveda physician. I request Dr. Pradeep Zondhare, sir, to felicitate Dr. Venkat Dharmadhikari, sir. I invite Dr. Venkatesh Dharmadhikari, sir, on the dais on behalf of this fourth national conference. On behalf of ATA, we would like to felicitate your work and your efforts in the field of Ayurveda. Dr. Pradeep Zondhare, sir. I invite Dr. Dudmal, sir, to felicitate Honorable Assistant Director of Ayurveda, Pune, Dr. Venkat Dharmadhikari, sir. Thank you, sir. Thank you, Dudmal, sir. Thank you, Dharmadhikari, sir. Once again, I would like to invite Dr. Chaudhary, sir, to felicitate our guest speaker, Dr. Pankaj Vanzar-Khedkar, sir, for a token of appreciation. Dr. Manoj Chaudhary, sir. Dr. Pankaj Vanzar Khedkar. Thank you, sir. Dr. Manoj Chaudhary, sir, I request you to felicitate I request Dr. Chaudhary, sir, to felicitate Chairman, Session Chairman, Dr. Ukharkar, sir, with a memento. Thank you so much, sir. The first scientific session of this conference is over. I request all the dignitaries on the dais to take a chair in front of the dais. Thank you so much.
Thank you, Dr. Aishwarya Ranade, madam, for hosting and coordinating this scientific session very nicely. I request you to please be on the stage. Ma'am, please. And accept the token of appreciation from the organizer. I request Dr. Anand Margundi, sir, Treasurer, National Executive Committee, Ayurveda Teacher Association, to please felicitate the session coordinator, Dr. Aishwarya Ranade, ma'am. I request Dr. Anand, sir. I request Dr. Anand, sir, to please felicitate our session coordinator, Dr. Aishwarya Ranade, ma'am. Thank you, ma'am. Thank you all. Now, keeping time conscious, let us move on to the next session. The topic of second scientific session is Ayurvedic evidence-based clinical solutions to male infertility. And I request the session coordinator, Dr. Gopal Jadhav, sir, to please come forward for hosting this session.
Our second sessions coordinator, Dr. Gopal Jadhav, sir, is currently working as an assistant professor in the Department of Sero Prasuti Tantra at Government Ayurveda College, Nanded. He had published a number of research papers and currently working as an active member of NEMA, KAGOF, NEMA Obstetric Gynec Society. He is also worked for the programs for water conservation and tree plantation through UA Nanded Group at Nanded. So I would like to welcome to our second session coordinator, Dr. Gopal Jadhav, sir. And I would like to hand over the mic to Dr. Gopal Jadhav, sir. Thank you.
Thank you, Praveen, sir. Very good morning, one and all. I welcome you all in this second session. I am feeling very proud and honored being coordinator of this session. In the current scenario, as we know, the basic solution definition of infertility is the disease of female reproductive system in which she is unable to have a pregnancy for the period of 1 year or more without practicing any contraception. Infertility affects millions of the people of reproductive age group worldwide, and it has an impact on their families and communities. It's basically caused by the number of different causes, and as such, we have this session today on Ayurvedic evidence-based clinical solution to male infertility. For this session, we have with us Dr. Manoj Gaikwad sir as the chairman of this session. Respected sir, please come to the dais. Dr. Manoj Gaikwad sir is a professor and HOD of Sri Rog Prasutantra Department at R.A. Poddar Ayurveda Medical College, Worli, Mumbai. Please take your seat, sir. Dr. Gaikwad sir has completed his BMS in 1989. Later on, he has completed his post-graduation and PhD in 2008. He has experience of teaching job in various Ayurvedic institutes like Ayurveda Mahavidyalaya Hadapsar, Tirak Mahavidyalaya Pune for the year of 15 to 16 year. Then he has selected through MPSC government professor and joined as professor and HOD at Government Ayurveda College, Nagpur in 2012. Currently, sir is holding the post of HOD and professor at R.A. Poddar Ayurveda Medical College, Mumbai. Sir has guided 18 MD students and 2 PhD students. He has number of publications and paper presentations at several places and reputed journals. Sir has attended many of the seminars and his training programs, including Dr. Palet's Foundation's ROTP program in 2008, training of ISOF installation and use in 2010, and training of fundraising organized by the Sage Tarachandra Dharmat Hospital in 2009. He has also completed the research basic and advanced research methodology training programs. He has awarded as PhD by Pune University in 2008. His achievement is Best Teacher Award in 2010 by RSM and Dharmantari Puraskar in 2009 by the Ayurveda Vidyapit. Welcome, sir. Our co-chairman for this session, Dr. Pradnya Deshmukh, ma'am. Please welcome on the dais, ma'am. Dr. Pradnya Deshmukh. Madam. She has completed her BMS in 2000 and also completed Panchakarma diploma in 2001. He has passed Sri Rog Prasutantra MS and achieved gold medal in the exam. She is pursuing PhD at R.A. Poddar Ayurveda Medical College, Mumbai, working as an assistant professor at Chaitanya Ayurveda Mahavidyalaya and Saptashringi Ayurveda Mahavidyalaya, Nashik. Now working as professor and HOD, SMBT Ayurveda Hospital, Dhamangaon, Nashik. She has published several articles and research papers in peer-reviewed journals. She is interested in the field of infertility and especially PCOS. She has conducted many of the social activity camp for poor peoples, especially like menstrual hygiene, infertility camp and ANC checkup camp. So thank you for gracing this session, ma'am. Our second co-chair, Dr. Sunil More, sir. Sunil More, sir. Might be he's stuck up with somewhere in the traffic. As soon as he will come here, I will call him on the stage. So, without taking any more time, I request Dr. Pradnya ma'am to introduce today's guest speaker of this session. Madam.
Thank you, Dadav sir. And very good morning to all. It's my pleasure to introduce our today's guest, Dr. Madhav Diggavi Acharya. Sir has completed his BMS in 1994, Hubli Karnataka University, Dharwad, with 5 consecutive ranks. He has completed his MD from IPGT and RA Gujarat Ayurveda University, Jamnagar in 1998. Sir, currently working as a professor and HOD in Department of PG Studies in Kai Chikitsa, also as a coordinator in PG Studies in Taranath Government College and Hospital, Bellary. Sir has a vast teaching experience of 22 years in UG and PG sessions and has clinical experience of 20 years. He has treated 90,000, rather more than 90,000 cases successfully with only Shuddha Ayurveda treatment. He is definitely an expertise in Kai Chikitsa, Panchakarma, Rasayan, Vajikaran, Manasro, thyroid and spine disorders. He has presented 3 international papers, 10 national papers, 30 state papers and 10 publications. He has given 5 radio talks, 5 TV programs. Till date have invited as a guest in more than 150 programs. He has attended conferences, 4 conferences as chairperson, has given keynote addresses in 5 conferences, guided PG students for 30 dissertations as a co-guide in 9 dissertations. He has completed his research project in management of anemia with Dhatri Loha. He is currently working as an honorary consultant in Bengaluru Panchakarma Center, Bengaluru, Vatsal Healthcare Center, Bellary Hospital, and working under Vaidya Shrikant Bagewadikar sir, Solapur, on cancer and multi-organ failure. Another feather in cap is he is a former member of CCIM Syllabus Committee, CCIM Visitor New Delhi, ex-BOS member RGUHS, peer reviewer IU International Journal, examiner for RGUHS Bangalore, GAU Jamnagar, Amruta School of Ayurveda Kollam, and has organized ROTP National State Conference, CME workshops, RGUHS study material workshop as per CCIM syllabus of BMS. So we are really honored with such a legend guest speaker. So without wasting time, I request our today's guest, Dr. Madhav Diggavi Acharya, to please come on the dais and start with his lecture.
Thank you, Deshmukh ma'am. Please. I welcome sir for his speech.
देवो वैद्याय विद्महे धन्वन्तरे च धीमहि तन्नो देवः प्रचोदयात्। रागादिरोगान् सततान् शक्तान् अशेषकाय प्रसतान् अशेषान् औत्सुक्यमोहारतिदान् जगहना यो अपूर्व वैद्याय नमोस्तु तस्मै। Sabhabhyo Namaha. With great salutes to the lotus feet of Lord Dhanvantari, respected chairperson of the session, Gaikwad sir, the co-chairperson, Dr. Deshmukh ma'am, thank you for a good introduction about me. At an outstretch, I am thankful to ATA for giving me an opportunity to share few words in front of you. Thank you, Dr. Suryavamshiji, all the organizing committee members of this fourth ATA conference, respected dignitaries in front of the dais, and all the delegates. Welcome to the field of andrology. Today, it's once again an examination for me. You're all examiners. How best I will contribute to the evidence-based Ayurveda. You are the judges. Without taking much of the time, next slide please. Let us work on. He is a legendary in Karnataka, Professor late Dr. M. Ishwar Reddy ji. Next. Another legendary of Kaya Sampradaya, Professor S. N. Oja ji. And next, Professor Padma Shri, Dr. Gurdeep Singh ji. With all these legendaries' support, today I am presenting few words. Rasayana Tantra and Vajikarana Tantra are two branches of Ayurveda which are not explored. A lot of hidden evidences are there in practice. Rasayana Tantra, as the name supports, it is going to do two important aspects. One is Vayasthapanam, another is Rogapaharana Samartham. And Vajikarana Tantra itself is defined beautifully. Alpa Dushta Kshina Vishushkaretasam. There are four diagnostic criteria. Till today we get these cases. That is important. What is the evidence? With current andrological technologies, we are able to diagnose Alpa Shukra, Dushta Shukra, Kshina Shukra, and Vishushka Shukra. So we get oligozoospermia, we get pyobacteriospermia, oligoasthenoteratozoospermia, and we also get aspermia. There is an ejaculation. There is no ejaculation at all. Or sometimes people come with the complaints of retrograde ejaculation. These are all Vishushka Retasa. So Vajikarana Tantra will give you the answer that Apyayanam, Prasadam, Upachayam, Janana Nimittam cha is Praharsha Jananartham cha. Praharsha Jananartha is erection disorders will be treated by Vajikarana drugs, and Shukra Apyayana Chikitsa, Shukra Prasadana Chikitsa, and Shukra Upachaya Chikitsa, and Shukra Janana Chikitsa, Shukra Pravartana Chikitsa. These are all beautifully explained by Acharya Dalana, that Shukra Janaka, Pravartaka, and Janaka Pravartaka component of drugs are having their existence till today, and their effects are presented in front of you in this workshop. Next. This is the andrology lab where I work. This is the only andrology lab in Ayurveda sector all over India, which has got WHO specified CASA as one of the software for this with a phase contrast microscope. In normal pathological laboratories, these are not available. So this is the evidence that a phase contrast microscope with CASA software will give you WHO standard accurate semen parameters. And if I can prove on these parameters, and that is the evidence-based Ayurveda. Evidence is collection of the data and presenting evidences at different levels of evidences, and we can contribute to there. And also, this semen lab is exclusively set up in government sector. And in Karnataka, there are only two CASA operating software offices in Karnataka state. One is in Manipal Hospital and second is in Taranath Government Ayurvedic Hospital. Next please. In this CASA software, we are able to document the motility in videograph and document the count, motility and abnormal morphological changes for many number of cases. We can document and store. Next. Where our postgraduate research workers are also working on this. And Uttarabasti is a procedure which is used in the process of Shodhana, Shamana and Vajikarana Chikitsa. In the OT itself, we are giving Uttarabasti Chikitsa. I'll show you the data in future. In the OT procedures are maintained so that no complications of Uttarabasti have been observed. Next. So these are the instruments, very simple instruments required for male Uttarabasti, a 6 mm rubber catheter and 50 ml dispo van. And after doing all surgical pre-operative procedures, the rubber catheter will be introduced into the penis. This is intravesical Uttarabasti, where we are installing the Uttarabasti drug into the bladder, and patient will have its systematic effect. That I will tell you in the future. Next, please. If you want to see the evidences, double click on that, video will come. So, in a Uttarabasti procedure, it is very simple, at the same time it is very cost effective. What we do is, click on that video, on the center of the slide. It's not coming. So in Uttarabasti, what we do is, previous slide please. What we do is 40 to 50 ml of sterile drug taken into the 50 ml syringe, and after the pre-operative cleaning and all the safety measures, the drug is installed into the external urethral meatus. Then the catheter is passed into the bladder, and in the bladder 45 ml of drug is installed. And after the removal of the catheter is removed, and Viruddha Upakrama, Viruddha Gati, gentle massage is done on the pubic area, and patient is discharged. It is a OPD procedure of just 7 minutes time it takes, and after 2 to 3 hours, urine will pass. Before giving the Uttarabasti also, patient's bladder is cleared, and after the 2 hours or 3 hours of the Uttarabasti, patient will have urination, followed by the drug will come out. The Dravya Pratyagamana takes place. Next, please. So with this, I know that all the teachers are, respected teachers are participating here. Rather than going to the theory, we'll see some case studies. That the evidences what I quote is the case studies. The case number 1, next please. In the case number 1, what we see is a 36-year-old male, the name is changed. He is an engineer by job. From Bangalore, he came for the treatment. His primary problem was male infertility with erectile dysfunction. So in this patient, what has happened is, very sensitive issue is, it is a hormone-based problem. Male infertility since 5 years, married for 5 years, there were no conception or abortions, and patient is having attributed to the masturbation habit. Whether it is right or wrong, that is a different discussion, but he was having a masturbation habit before marriage and also after marriage. He was having COVID-19 vaccinated, having a grade 1 varicocele. In the ultrasound scanning of the scrotum, we came to know that grade 1 varicocele was documented before treatment. Next, please. In this patient, what are the complaints? What we understood is, he is having aputratvam, no issues. He is having mild testicular tenderness, and he is having erection failure, that is Dhojabanga, inhibited sexual desire with erectile dysfunction, and he is having Moga Sankalpa Cheshtata. What is that is, he is futile to carry any sexual intercourse, and morning erection, that is nocturnal penile tumescence, was absent. What we do is, we tie a simple stamp paper around the penis at night. Gently it is tied, and in the morning when penile tumescence, penile hardness takes place between 3:30 a.m. to 5 a.m. In that paper will be opened. So nocturnal penile tumescence, we have made an objective parameter. In that it is known that patient is not having nocturnal penile tumescence, and associated with general Daurbalya Sadanam Shramam. Next please. And patient semen analysis showed he is having only 5 million sperm count, where 15 million sperm count is normal, 10% active motility is there. Actually 50% active motility should be there, or combined SLP and RLP should be 50%, but patient was having less. On February 28, it was observed in the scanning that mild dilated pampiniform plexus of the veins 2.5 mm in diameter seen within spermatic cord, suggestive of grade 2 varicocele. Minimal free fluid noted in the left vaginal sac. Next please. So the patient was taken for the treatment. Deepan Pachana started with Haritakyadi Yogam of Charaka Samhita Chikitsa Sthana, Rasayana Pada, first chapter. This Haritakyadi Yoga 4 grams 3 times a day before food with lukewarm water for 5 days it was given, and followed by that Niruha Basti with Ashwagandha the Kashayam, Saindavalona, Madhu, Ashwagandha Taila 80 ml. Ashwagandha Taila is Shodhita Ashwagandha roots. Ashwagandha roots are boiled in milk, dried, and Murchita Taila is prepared. And in that Murchita Taila, again Ashwagandha Kashaya, Ashwagandha Kalka Siddha Taila was prepared. That is used for 80 ml. Shatapushpa Madanafala Kalka and Ashwagandha the Kashaya 280 ml was given for Nirohapasti. And this patient had Uttarabasti in 3 setup. Uttarabasti with Ashwagandha Taila, the same Ashwagandha Taila which is prepared in the department is used. 3 days Uttarabasti is given consecutively. Later on 3 days gap is given. 3 days again Uttarabasti is given. And again 3 days gap is given. And last 3 days Uttarabasti is given. Total 9 days of Uttarabasti with gap is given. And this is one course which is completed. Next please. At the end of the treatment, semen analysis showed quantity improved from 1 ml to 3.5 ml. This is Shukra Janakam. This is Retas Janakam. Shukramiti Retas. Retas is also synonym. Retas means Rupa Dravyam. Acharya Charaka says Rupa Dravyam, which is ejaculated out of the human male body, is Retas. That is Rupa Dravyam. It is quantitatively increased from 1 ml to 3.5 ml. 1.1 ml is normal range and patient has got 3.5 ml. Count increased from 5 million to 55 million at the end of Niruha Basti, 3 Niruha Bastis and 9 Uttara Basti course. Acharyas have an opinion that 3 Niruhaitva Uttara Basti Madide. So once we give 3 days continuous Niruha Basti per rectally and then per uretrally we give 9 Uttara Bastis. With that, we can see that there is a significant increase. And for this, the third umpire, that is third party evaluation, is a male gynecologist, Dr. Virendra Kumar, professor and head of the department in the medical college. He has sent the patient and he is observing the patient. That is third party evaluation. He is the third umpire who is certifying that. He said, with modern intervention, this is not possible. So, with even hormone therapy, we don't expect this much of result. And let us work on this. So, we started working continuously on this parameter. And motility, which was 10% before treatment, has increased to 30% active motility was there, and 10% sluggish motility was there. Totally 40% RLP plus SLP. And for your kind attention, you can see in this next section, when the February before treatment scanning was there, in the 4th month, April 8th, no significant abnormality in the scrotal USG. A complete reversal of 2nd degree varicocele is reversed, and the fluid collection is also reversed. So this is the evidence what I want to contribute to the learned audience in this ATA conference, that Ayurveda can do significant changes ultrasonographically and on par with WHO standards of CASA based semen analysis parameter. This is first case. Next please. So this is the before treatment and after treatment of that patient, where you can see that the ultrasound scanning is like this and 5 million count was this. Next please. This is the complete reversal. The Clarity Diagnostics radiologist came to my clinic after seeing this case and said, what you are doing? The radiologist asked me what you are doing. Before treatment and after treatment, significant changes are there. Let us work on this and do further studies. Next please. This is another patient named Kumar Swami, 35-year male. He is a manager in Mahindra showroom. He came with erectile dysfunction, a classical Dojabanga case. Next please. He is having Doja Anuchraya, inability to have erections, and followed by Linga Shaitilyam, Mlana Shishnata, no erection at all. And patient is having Surata Akshamata. He is unable to do penile strokes with the partner and lack of sexual desire. There is a mentally he is not having desire at all. This is complete Shandatvam or complete Dojavangam according to Acharya Charaka, and associated with Daurbalyam Sadanam Shramaha. They are all Clive elections. Next please. On investigation, we came to know that patient is having 1.5 ml of the semen. Fructose is present, so there is no obstruction in the Shukrava Srotas, and ejaculation showed 34 millions of count, and motility is almost 30 plus 10, 40%, and it is normal. See, semen analysis is normal before treatment, but erection is completely in trouble. Next please. And patient showed the normal follicle stimulating hormone, luteinizing hormone, and prolactin. Because in the male erectile dysfunction, we commonly notice prolactin hormone is increased. hyperprolactinemia is one of the cause for male erectile dysfunction. In this patient, that is not seen. Next, please. Whereas his testosterone is also 450. See, testosterone is normal, prolactin is normal, semen parameters are normal, still he is having erectile dysfunction. This is a case where we treated on the same lines Harithakyadi Yogam for Kaya Shodhanam, followed by Ashwagandhadi Niruham, and followed by Ashwagandhadi Taila Uttarabasti. 40 ml of Uttarabasti, that is less than 1 pala was given. Same 3 days of Niruha Basti, followed by 3 days of Uttarabasti, 3 days gap, again 3 days of Uttarabasti, once again 3 days of gap, and last course of 3 days of Uttarabasti was given with Ashwagandha Tailam. Single drug, Ekamulika drug. Ashwagandha Kalka, Shodhita Ashwagandha Kalka, Ashwagandha Kashayam, and Murchita Telatailam were simple ingredients, which is not available in the market. We have prepared. Next, please. So, what we have seen is this is the follow. Regularly, the patient was followed up. Every sitting, we documented the case. What we observe is Niroha Basti, Dana Kala, and Pratyagamana Kala is noted. And Uttarabasti, we give up to the 2.5 minutes time is taken while we are passing the Uttarabasti drug. Because if you give very fastly Uttarabasti, patient will have discomfort. If you give very slowly, patient will have no action at all. For that purpose, we have standardized 2.5 minutes of Uttarabasti given time. How much time is taken for Uttarabasti administration? Next, please. So report, what we see is at the end of the treatment, the volume was same, whereas sperm count is increased from 34 million to 50 million, and active motility increased from 30% to 50%. Okay, next please. Next slide. Here we see that the serum testosterone, which was 459 international units before treatment, has increased to 506. So by Uttarabasti, we are able to increase testosterone levels in the laboratory. Prolactin level, which was 9, has increased to 12. Both are normal. Next, please. So case number 3, Jafar Hussain, 29-year-old. He is a tailor by occupation. He was having oligoasthenoteratozoospermia. We call it as OAT syndrome in our practice. Oligoasthenoteratozoospermia. Count is less, motility is less, abnormal forms are more. In this case, next please. In this case, he was also having a varicocele. He was married since 3 years. Primary infertility was there, associated with Katishulam, Agnimandam, and Amlapittam. These are the associated symptoms. Next, please. So, in the investigation, we came to know that it was 24 million count and active motility was 20%. Next, please. This is another co-guide for our is professor in urology from the Government Medical College, Bellary. So, he is third umpire for this case, and who regularly sees all erectile dysfunction case in his OPD. And now we are doing a collaborative study with Medical College professor in urology. One RGHS university project we have taken for 20 lakhs, where he is the co-principal investigator and I am the primary principal investigator. We are working on this. The patient was having grade 1 varicocele and the small right epididymal cyst was noticed. The urologist has done the scan this and then sent the patient. Next, please. And the treatment was done with Ayurveda parameter like for Deepana Pachana, Chitrakadiviti, Panchakola Chuna, Ashwagandhadi Kashayam was given. And then with Snehapana was given with Ashwagandhadi Yamakam. Sahasrayogam, Kerala pharmacies manufacture this. The 40 ml test dose was given and 100 ml next fixed dose Snehapana was given. With Vishramakala, Kshirabala Taila Abhenga was done. And Virechana was done with the Trivrit Leha 35 grams. Next, please. And patient tolerated the treatment very well. Next, please. This is our OPD slip where we maintain. And Vajikarana Chikitsa given was Ashwagandharishta special, which is a Vrishya Asavarishta. And for your kind information, Ravana Kruta Arka Prakasha, he says Asava and Arishta are the best kalpas compared to Swarasa, Kalka, Kvata, Vati kalpas. They are very fast acting and they are the superior quality manufactured drugs. So Puti Karanjasava was tried from Sahasra Yoga and Amrutadi Gugulu and government hospital available churnas were selected and given. In this case, Amalaki, Yeshtimadu, Haridra, Arjuna and Kirata Tikta with the Trivrit Churna was given and all are in equal quantity. 40 ml Kshirapaka was done and added with Guda because to reduce the Tikta Rasa, we have added Guda and given. Next, please. 3 months course made that the patient treated with this case has improved sexual power, morning erection, that is nocturnal penile tumescence increased, penile hardness increased, and activeness in the sexual congress was improved. Counseling was done and confidence was improved by our counseling technique. Next, please. Patient showed after semen analysis 1.5 ml volume increased to 2 ml. See, the count increased even though before treatment count was normal 24 million. It has increased to 65 million after the treatment. And after the treatment, the motility improved from 20% to 30%. Okay. Next, please. So in the ultrasound scanning, the patient's wife conceived. This is the success rate, that in Vajikarana success rate in the patient, male patient we see, but that's not the final assessment. The evidence that his wife conceived after 3 years of primary infertility is the conception rate, and it is the evidence-based medicine. A very good example that 8 weeks, 5 days, good cardiac activity, single live intrauterine gestation was noticed. This is one of the evidence in 3 months course. Next, please. And she delivered a female child also now. And fourth case is, it is one beautiful case of arterial insufficiency. People, whenever we treat with Vajikarana drug, they say that, see, erectile dysfunction is a psychological problem. You give any Vajikarana drug, Leha, this and that, and local application, patient will improve by psychological confidence. It's not true. We have taken an organic impotence, where arterial insufficiency was diagnosed by penile Doppler study. Penile Doppler study is a gold standard method to diagnose arterial insufficiency induced erectile dysfunction. A Venkatesh patient, 50-year-old, see, 50-year-old man want to have an erection, and this is not for infertility purpose. This is purely erection purpose. I still remember when I was a PG student at Jamnagar, Acharya Jyotir Mitra visited our institute for inspection. He asked, in your andrology lab, how much old age patients have been tested for semen analysis? Give the data. Then we were shocked. We were students or scholars, we were shocked. No elderly patient come to our Vajikarana lab, so we have not documented. But now see, 50-year-old married man having erectile dysfunction with arterial insufficiency was treated. He was having Dvajabhanga, Linga Shaitilyam, and Mlana Shishnatvam, no erection at all, flaccid penis was there. Next, please. He was having all these complaints. Along with that, important thing to note is that he was having diabetes type 2 on modern medication since 2 years. And he was a smoker. See, both are very important causes of male erectile dysfunction, smoking, and next is the type 2 diabetes. So diabetes induced arterial insufficiency, and then patient is having erectile dysfunction. This is one of the Avaranajanya penile artery disorder, and then patient is having erectile dysfunction. Next, please. He was a smoker for 20 years. Semen analysis, he was unable to ejaculate and collect the semen. See, 50-year-old man having children, unable to collect the semen sample for our testing. So we are unable to do the semen test. So this is one of the area where Vishishta Retasam, no water is coming out. What is the word meaning of Klebya? Klebya means Klebatvam. Klebatvam means impotence. Impotence means no water. This is the dictionary meaning. Impotence means no water. No water means no semen. In this context, it is not water, it is semen. So there is no fluid. In this patient, features are suggestive of erectile dysfunction due to arterial insufficiency. Next, please. In the March, we have tested this. Haritakyadi Yoga is one of the best yoga to start before Rasayana and Vajikarana. And then we gave 3 days of same Ushwagandha, the Niruha Basti for 3 days. 3 consecutive days of Niruha Basti without Anvasana, followed by that 3 days of Murchita Tilataila Uttara Basti. So we have done carefully Murchita Tilatailam, which was with us, and we have given only Murchita Tilataila Uttarabasti for the patient of erectile dysfunction with arterial insufficiency. 3 days of Uttarabasti, gap of 3 days, again 3 days, and 3 days gap again, and we have done 3 days last course. With this, it is very interesting to know that, next slide, interesting to note that after the treatment, he was able to give semen sample. Before treatment, Vishishta Retasam. After treatment, he was able to give 2.5 ml of semen. So 65 million count was there, 50% active motility was there. Penile Doppler study showed normal Doppler study. Before treatment, features were erectile dysfunction due to arterial insufficiency. After treatment, arterial insufficiency is reversed by Uttarabasti. Next, please. So this is the clarity diagnostic. Before treatment, you can see arterial insufficiency. Arteries are less than normal, more than 10 centimeters. The pre-injection bilateral cavernosal arteries are less than normal.
So after the treatment, you can see normal Doppler study. Post peparin injection, there is delayed but presence of expected normal persistent increased PSV and reversal of diastolic flow in the bilateral cavernosal arteries with normal PSV of cavernosal arteries after 5 minutes of peparin injection. We do pipe test. Pipe test is peparin injection will be given to the penis and erection is noticed. And the doctor has clearly given a paragraph that before there was absence of expected normal persistent increase in PSV, whereas after the treatment, there is normal PSV. This is the evidence-based Ayurvedic practice in a clinical setup like a government hospital practice. This much we can do to the public service. Next, please. So, semen analysis is 65 million of that patient. Before treatment, unable to ejaculate. After treatment, he has ejaculated. Next, please. So, with these 4 clinical presentations for your kind attention, let us talk few things about male infertility. Next, please. Male infertility is 40 to 50% of male persons are showing couple infertility, and infertility is 1 in 6 couples. Nowadays, people are in very hurry to do MD, PhD, and DM studies. Further, I want to settle my clinic at Pune. I want to have 2 clinics, one in Pune and Mumbai. I want to have another peripheral clinic in Bangalore. I want to fly to Bangalore and consult and come back. Then I want to marry. By that time, there is no need to marry. Actually, after 25 years female, there is no need to marry for fertility purpose. By the age of 25, the AMH hormone level rises. In the first patient, I forget to tell you, the first case of oligospermia, in the male patient, AMH level was raised. And after 25 years, every female will have AMH related issues in the current andrological practice. And half of all infertility cases, male patients are about 10%. So, unfortunately, due to the taboo, male will not come to the clinic. Female will come to the clinic. Then we have to pursue them, and male person will come, and then we investigate the patient. Next, please. The incidence rate is infertility is 15%, male is 50 out of that, and azoospermia is 20%. Nowadays, I am seeing because of CASA lab, we are having a very good opportunity for evaluate, but only azoospermia cases are rushing to the clinic with a hope that Ayurveda can do something. But I'm not working on azoospermia, and I'm not putting any data on that. Next, please. But incidence rate of azoospermia is increasing. See, infertility is due to 2 things. One is either semen disorder or another is erection disorder. One is sexual issue, another is spermatogenesis issue. Okay. Semen quality and quantity are declining. Dr. Krishnamurthy, one of the famous andrologists in Mumbai, who is the brother of Kavita Krishnamurthy, famous playback singer, he has given a data that male sperm count is declining from decade to decade. If I remember all my seniors, when you were the student, 165 million was normal sperm count. When I was a PG scholar, 65 million was normal. But when I was a final year PG scholar, 20 million was normal sperm count fixed by WHO. But now the WHO has changed the normal count of the male is 15 million is normal. They are declining the normal standard itself because we are not getting any 200 million sperm count male or 100 million sperm count is very rare. That's why normal standard is decreased. Next, please. So this is male Shukravasrutas, Shukravasruto Mula, the Vrushanau, Shefaha, testis, germinal epithelium, spermatozoa. These are well known to you. Male spermatozoa is one of the best outproduct of testicular germinal epithelium. Testicular germinal epithelium can be considered for our evidences as Shukradhara Kala. And Shukra is semen plus androgens. For our evidences versus Shukra is sperm plus semen plus androgens. This combination can be taken as Shukra. Next, please. In Shukravasrutas, there are different organs working in an orchestra-like way where all are synergistically working. Next, please. So in testis, if you know very clearly, you can see a chakra. In this testis, you can see a chakra. This is related to Mooladhara Chakra. Mooladhara Chakra, one is at the spinal cord level, another is at the level of germinal epithelium level. Next, please. The epididymis is one of the important area where epididymal cysts are very common in male spermatogenesis. With our basti and basti, epididymis and epididymal growth, cysts can be resolved. Next. Epididymis stores and sends this semen and sperm. Actually, the epididymis, there is no motility for spermatozoa. When they come to the prostatic urethra, when prostatic secretions and seminiferous ducts secretions come to this spermatozoa, sperm starts becoming motile. Then they will be ejaculated. Next, please. So seminal vesicles, I have seen seminal vesiculitis having crystals. Seminal vesiculoliths are very common nowadays. Shukra Ashmaris can be detected with ultrasound scanning, scrotal Doppler scanning. So, or per rectal USG. So, this is evidence-based Ayurveda. Modern diagnosis, Ayurvedic treatment, modern assessment parameter. This is Professor K. N. Udupa's model from BHU. Modern diagnosis, Ayurvedic treatment, modern assessment. This is the best formula for our evidence-based Ayurveda. Next, please. In prostate, actually prostate has got a beautiful action on male sexual performance. What happens is, it is having prostate specific antigen. If it is raised, it is a marker for, evidence-based marker for prostate cancer. Along with that, pepsinogen, lysozyme, amylase, hyaluronidase. These are all the enzymes, along with the acid phosphatase, are secreted by prostate. That's why there is a peculiar fish odor or matsya gandham for male's semen. That smell is due to acid phosphatase, amylase, lysozyme, pepsinogen. These are the enzymes. These are the Shukra Dhatvagnis. For Shukra Dhatvagnis, these are the markers in evidence-based medicine. Next, please. 25% of the volume of the semen is contributed by this prostate. Spermatogenesis, you know, this is Bija Pradoshaja Vikara. Whenever spermatogenesis is affected, we will not get 4 spermatozoa. In the metamorphosis, there are 4 spermatozoa produced. This spermiogenesis takes place 15 to 17 days, and accordingly we have done that 3 days Niruha Basti and 9 days of Uttara Basti with 6 days in between the gap. Totally 15 to 7 days spermiogenesis time takes place, and 15 to 20 days is our program schedule, protocol schedule we have fixed. So in 20 to 22 days, we are able to show significant changes. Next, please. So factors influencing the spermatogenesis, number 1, hypothalamus. So pranavata sthana, prano atra murdagaha. Pranavayu is responsible for apana karma. When prana and apana along with vanavayu, I call it as prana, vana, apana axis. If these 3 are working properly, erection and ejaculation and spermatogenesis takes place properly. If pranavata moolasthana, mastika is affected, hypothalamus is affected, then pituitary gland is affected, or Leydig cells in the spermatic testosterone or testicular germinal epithelium, Leydig cells are affected, then there will be infertility. Testosterone is required in large local concentration to maintain spermatogenesis. Testosterone is secreted by 2 places. One is testicular germinal epithelium, another is adrenal glands. So, adrenal gland is Sarvadahika Shukra, testicular testosterone is the Sthanika Shukra. These 2 Shukras are performing, and when adrenal glands are removed by surgery due to any reason or any cancer, then only testicular testosterone is functioning. Next, please. So, Shukra is Sarvadahika, Manas is Sarvadahika, Ojas is Sarvadahika, Rasa is Sarvadahika, and Atma is Sarvadahika. So, Shukra, Acharya Sushruta says, just like a mother gets the dream of the baby or the imagination of the baby feeding and she starts lactation in Sushruta Nidanasthana 10th chapter. In the same way, when a male thinks about the female spouse or imagination about this, the sexual intercourse, the Sarvadahika Shukra Chayana takes place, then it comes to the Shukra Vasvato Mula, and from there, Rupa Draga is ejaculated. So, any relation to diet, vitamin B, E, A, these 3 are going to decide the Shukra Vasvata's activities, anabolic steroids, cadmium and lead. These 2 toxicities will cause a problem. X-ray exposure, X-ray lab technicians will have this more, and digoxin, alcohol, infections. Any modern antibiotic other than amikacin will decrease this sperm count. We have done a data. Except amic acid, all antibiotics will decline spermatogenesis and sperm count. And all antihistamines, levocetirizine or any other best group of antihistamines decline sperm count. You can imagine in the Pune and Maharashtra, due to the COVID bout, lot of antihistamines are used by the public, either by advice or self-medication. Even paracetamol is also going to decline the sperm count and quality. So in that scenario, any drug or any alcohol, smoking, pollution will all decline the sperm count. Penicillin injection, I have a data, when penicillin, Penidur or penicillin injections were practiced 15 years back, immediately before penicillin and after penicillin, we have taken semen sample, sperm count declines by 30%. Next please. In adolescents, especially high school children, administration of antihistamines is more dangerous for spermatogenesis. I have got one theory since my 22 years of clinical practice. Spermatozoa has got head, mid-piece, tail. Head contains nucleic material, the chromosomes, genes, everything is there. Mid-piece is mitochondria. Tail is plasma membrane and flagellum. Tail is responsible for motility. Mid-piece is responsible for giving mitochondria and energy. And head is responsible for nucleic acid material and our chromosomal transfer. Can we think like this? I work on like this. Head is heavy, round, and contains all kapha material. So the kapha sthana in spermatozoa is head. Mid-piece is energy storehouse, mitochondria. It is pitta sthana. Tail is vata sthana. Accordingly, I diagnose Ayurvedically, if head abnormalities are there, kapha se shukra drushti, treat Vamana, Virechana, Basti, Uttar Basti, and Bhalataka Rasayana. Patient will improve. And mid-piece abnormalities, motility disorder due to mitochondrial defects, and we can do that. DNA fragmentation study we are doing in our government andrology lab hospital in Ayurvedic Institute, where mid-piece abnormality, DNA fragmentation disorders are there. We treat Virechana, Basti, Uttara Basti, and Sariva Rasayana. Single drug Sariva is very good for Pitta Shukra Drushti Nashanam. There is no secret in this. Dear friends, we are all teachers. If you are able to give some 10 points, the carrier will take 2 points. And you may practice 1. And definitely, if all teachers in this auditorium start practicing, Kaphaja Shukra Drushti is head abnormalities, Pittaja Shukra Drushti is mid-piece abnormalities, Vataja Shukra Drushti is tail abnormalities. I see in microscope 2 tails, 3 tails, stunted tails, and very short tail. These are all the tail abnormalities. And sometimes mid-piece is very short, mid-piece is absent. Sometimes head is very small, head is very large. All these things we think about Panchamahabhuta theories can be applied on spermatozoa. Tridosha theory can be applied on spermatozoa. For Kaphaja Shukra Drushti, Bhalataka Rasayanam. For Pittaja Drushti, Sariva Rasayanam. For Vataja Shukra Drushti, Agnitundi, Vishatunduka Rasayanam. Karaskara Vrutam is available in Kerala market. Very good drug for tail abnormalities or Vataja Shukra Drushti. Next please. So this is at cellular level, Vata Pitta Kapha can be thought. All teachers can opine on this. Next please. Testosterone is an important steroid hormone and it is responsible for all sexual functions and all sex and spermatogenesis related issues in the male. Male hormone is testosterone and it is having sex binding globulin, SSBG or sex hormone binding globulin. This is a protein. If SHBG is abnormal, I get in our patients, SHBG is raised, SHBG is decreased. Then also there will be male infertility. Next please. Next. So this testosterone is responsible for primary, secondary, hypothalamic or tertiary diseases of male HPG axis disorders. Next please. Hypothalamo-pituitary testicular axis is damaged, either due to diabetes, metabolic syndrome, obesity, rheumatoid arthritis. Nowadays, I am getting beautiful flora of cases due to methotrexate complications. See, rheumatoid arthritis, methotrexate is written. For psoriasis, methotrexate is written. For any ankylosing spondylitis or any autoimmune disorders, methotrexate is written. For all diseases, anti-cancer drug is a style of practice. We see in our clinical practice. And all these methotrexate group of people who take medicine, in their fertility period, they will get testosterone damages. And due to testosterone and testicular germinal epithelial membrane damages, they will come with male infertility disorder. Next please. Low testosterone level. Nowadays, I am documenting many cases. where testosterone level is low, erection is low, sperm count is low. This is another equation, which data I have not given here. It is another aspect. So they are also coming very regularly to the practice. And Ayurveda does definite changes, reversal of these clinical conditions. Next, please. So you can see whenever testosterone and bioavailable testosterone is increased, aging will be fast, cirrhosis will be fast, hyperthyroidism will be fast, anti-convulsant drugs will be causing more of the SHBG level abnormalities or bioavailable testosterone level abnormalities. When testosterone goes down, obesity will increase, nephrotic syndrome will increase, hypothyroidism will increase, glucocorticoid metabolism will disturb. See, hypothyroidism is testosterone decrease, hyperthyroidism is testosterone increase. Hypothyroidism is kapha-vata-janya vikara, hyperthyroidism is vata-janya vikara and vata-pitta-janya vikara. We get hypothyroidism with low sperm count, hyperthyroidism with low sperm count with low testosterone level. In these equations, the same clinical trial program what I have shown, that protocol works. Next, please. Next. In the testosterone, lot of things are there to tell, but most of the learned scholars are very well aware of it. In Shukra, Shuklayati, Tyajayati, Shuklam, Rajatam, Shuklam, Viryam, that is called Viryam. Amara Kosha says, this is Tyajayati, Tejayati, which is ejaculated is called Shukra, which is white is called Shukra. Shukra contains 4 Mahabhutas. One Mahabhuta is not there in Shukradhatu. Bahalam, Maduram, Snigdam, Avisram, Guru, Pichilam, Shuklam, Bahucha, Yat Shukram, Palavatta, Dasamshen. This is fertile semen sample. Next, please. All these can be seen in our naked eye examination. Bahalam, Shuklam, all these can be tested. Maduram can be tested by fructose content. Maduram cannot be tested by the Jihva Indriya. Pratyaksha Pramana is not to be done. Anumana Pramana by fructose level. Next, please. Saumyam Shukram. See, Saumyam Shukram, Artavam Agneyam. The whole universe is made up of Soma Suryani Lastata, Dharayanti Jagadeham, Kafapittani Lastata. Saumyam Shukram. Any Saumya Dhatu, Poshaka, Ahara, Vihara are there, or Aushada are there, they will work. See, Chira is Saumyam, Grita is Saumyam. Like this, Masha is Saumyam. All these Saumya Padarthas will increase Shukram. Next, please. Shukrava Sroto Mula, Shukravanam Srotasam Mulam, Rushanam Shefascha. No problem. Next, please. Next. So, ejaculation takes place. I was telling about the concept. When patient imagines, due to the imagination in the brain, he decides to have sexual intercourse, then semen starts oozing out of the srotas and comes out of the body. Next, please. The causes of male infertility are all these: dosha, dhatu, mala, mansa, and even daiva is also important cause for sexual dysfunctions. Daiva is our fate. Daiva is purva janma krita papam. Purva janmamiti janmat purvam. Purva janmamiti, the fertile period and it's before 20 years or 25 years of lifestyle is going to cause male infertility. Next, please. Shukra Dushti and Klaibya are important aspects. There are 8 Shukra Dushtis, and the causes are alcohol, smoking, illicit drugs, drug addiction, and overweight is also one of the causes. Kapha Meda Savrata Vata is cause for Medo Vriddhi, and Kapha Meda Savrata Vata also causes Shukra Dushti. Exposing to toxin or infections, overheating the testicles, tight underwears and jean span are going to cause the heat increase in the scrotum and sperm count declines. Next, please. Trauma and surgeries, and even varicocele, undescended testes. In every year, I get 3 or 4 cases of undescended testes in male patients who are married. Even after marriage, they don't know that testes are not descended. Scrotal sac is empty. And the intrapelvic testicle, which is undescended, will become carcinoma, testicular carcinoma. Next, please. Even chemotherapy can cause the sexual abnormalities and semen abnormalities. Ayurveda, Acharya Charaka says these are all the Chinta, Shoka, Kshara, Agni Vibrama, Kshara, Agni Vibrama. If Kshara Karma has got done some more damage, or Agni Karma near scrotum, or any other Bradna, or any other disorders when it is done, Shukram Sandhusheti Ativyayama, Asatmanam Sevana, Akale Ayono Gamanam. Akala Gamana is before marriage, having sexual intercourse is also Akala Gamana. Ayoni Gamana is Not having vaginal intercourse, having oral intercourse or rectal intercourse will also do these sexual problems. Next, please. Vegagata, Chata. See, these are all 8 types of Shukra Dushti. One is frothy, slender, acrid, discolored, putrid, slimy, afflicted with other dhatu. Anya dhatu samsrishta I have seen semen when we do in the microscopic study, especially in the phase contrast microscope, RBCs can be easily seen. In normal binocular microscope, we may miss RBCs in semen, but in phase contrast microscope, clearly RBCs are seen. Then it is called Anya dhatu samsrishtam. Rakta dhatu has entered Vimarga Gamana to Shukra dhatu. Rakta dhatu should be in Raktavasrotas, but Rakta dhatu has entered into Shukravasrotas. That is Anya dhatu samsrishtam. And Avasadi, precipitate. When you put semen into a beaker where water is there, drop 1 drop of semen. If it is going to settle down, it is Avasadi. Kafaja Shukra Dushti, Kafa Vataja Shukra Dushti Lakshanas are there. Next, please. So, Fenilam Tanuruksham Cha Kruchrena Alpam Maruta. Tanu Shukra Dushti is due to Vata. Ruksha Dushti, Ruksha means what? More fenilam, more the bubbles are there in the semen, then it is called Ruksha. Alpam, the quantity is less, pH is acidic, volume, transparent. Tanu and Shukra Taralyam, one word is in Vaisheshya Ratnavali is Shukra Taralyam. The water content of the semen is increased. Apmahabhuta Dushtin Shukradhat. Apmahabhuta is abnormally increased, is going to cause this problem. I'll finish. Next. Next. These are all the Shukra Dushtis. Sleshmana Baddha Margam to Bhavati Atyartha Pichilam. In Sleshmana Shukra Dushti, there will be obstructive uses permia. Obstructive uses permias are reversible. Next, please. These are all the diagnosis, semen analysis, ultrasound, transrectal ultrasound, hormone testing, and post-ejaculation urine testing. Next, please. Because in urine also semen comes. So these are the reproductive problems, medical problems like cystic fibrosis, surgical problems like arachidopexy, social problems like alcohol and tobacco, occupation problems like radiation and heavy metals. These are all responsible for male infertility. Next, please. Next. These are all causes. This is the approach to male infertility. Next, please. Next. If testis is undescended, testis is not developed. These are completely asadhya. Next, please. Management of infertility in general is Kaya Shodhana, Virechana, Basti, Uttara Basti. No shortcut, please. No Sadhya Virechana instead of Virechana. You should give proper classical Virechana with Snehapana, Vishramakala, and Virechana only. If you do shortcuts, results are minimized. And then Shukra Shodhanam, Shukra Janakam, Vrisha Rasayana. This is the pack of protocol for male infertility management. Next, please. Rasayanas, Bija Shuddhi, Sroto Shuddhi, Dhatvarni Vruddhi, and Dosha Samyatvam. Dosha Samyatvam is must for male infertility cases. And Saumanasya Jananam, mentally peace should be brought. And eugenics, a very perfect, genetically strong baby should be born. Next, please. Next. Grutam Jivaniyam cha Chavana Prasham. See, the Chavana Prasha Avaleha in Charaka has written the Shukrava Sroto Vikaras, Shukra Dushti and Artava Dushti, both can be treated by the Chavana Prasha Avaleha. Chavana Prasha is Shukra Dosha Haran, Reto Dosha Haran, and Bija Dosha Haran. Male and female both can be taken with Chavana Prasha. So we give Bhargava Prakta Rasayanam of Vatavadi Chikitsa, and this is effective. Next, please. In Vataja, Pittaja, Kafaja, Shukra Dushti, these are the line of treatment. Next, please. Virechana. In Virechana, Mahatikta Grita and Trivrut Leha are very effective. Next, please. Ashwagandha. These are all the Vimanasthana and Sushruta Sutrasthana giving so many drugs for Virechana Opagaganas. Ashwagandha, Kashmarya, Yashtimadu, Gavakshi, Dadima, Aragvada, Erendamula are to be used in Virechana for male infertility patient. Next, please. Snuhi Kalpa should not be used. And in Ativavaya Jana Kshema Shukra, this Drakshadi Niruha Basti of Charaka Chikitsa Siddhisthana, third chapter is effective. Next, please. And in case of Erendamula, the Yapana Basti of Charaka Siddhisthana, it is also effective in Apatya Kamanam. This Erendamula, the Yapana Basti is told for Apatya Kamanam. If you want one boy or one girl, very perfect in genetically and having all personalities and all characters are good, Erandamuladi Yapana Basti can be taken. Next please. Lastly, Hapushadi Yapana Basti, when patient is having erectile dysfunction with semen disorders. Next please. Lagu Panchamuladi Yapana Basti. Next please. Baladi Yapana Basti, we all try this in our clinical trial. Baladi Yapana Basti, it is indicated in oligoasternoteratosis spermia. And Shatavariyadi Sneha Basti, sure shot drug in male infertility. You remember from today that Shatavariyadi Gruta orally in Uttara Basti, in Anuvasana Basti, in Matra Basti, and in Miruha Basti. In all class, if you use Shatavariyadi Basti, there is no failure rate. That much of sperm count improvement will be there with this Basti. Next please. Shukra Kruta Basti. This is Saindava, Ardaksham, and Shaudram, Thailam, Payogrutam. All are food grade medicines. This Basti is also effective. Next please. In erectile dysfunction, Payasyadi Basti trials are going on. 30 patients trial is going on. So that's why data will be given later. Next please. Avarana Shukra Drushti, in that we can give Mustadi Yapana Basti and Madhwadi Yapana Basti, Madhu Tailika Basti, Bala Bilva Guduchi Haritaki Kuchala Jayapala Yapana Basti. These are all effective. Next please. In Shukra Drushti, in Vataja Shukra Drushti, Makaradhaja Rasayana, Swarnavangam, Amalaki Ganavati, single drug Amalaka Ganavati is effective in Vataja Shukra Drushti in Aligosus Spermia. Next please. Mahasha Ashwagandha Prayogam. Mahasha Ashwagandha very effective in case of Vataja Shukra Drushti. In Pittaja Shukra Drushti, Sariva Chandana, Amalaki, Guduchi, Kapikachu, Pippali, and Madhu Tailika Basti are effective. Next please. In Kapaja Shukra Drushti, Chandraprabhavati, Navayasa Loha, Palashaksharam, Ballatakam, Ashwagandham, Loha Vasmam are effective. Next please. In Puyaritas, Chandraprabhavati, Gokshuradi Gugulu, Swarnavanga. These three drugs will definitely reverse pyobacteriospermia. Chandraprabha, Gokshuradi Gugulu, Swarnavangam. Next please. In azoospermia, even the results are limited, Makaradhaja and Shilajatu Rasayana. Hiraka Rasayana. Hiraka with Rasasindura is effective in azoospermia. Next please. In Vajikarana drugs, Ekamulika, Smasha, Chataka, Jivaniyagana, and Hrudyagana, Brahmaniyagana, Snehopagana, Balyagana, these are all going to be very effective. Ekamulika Prayoga in Shukra and Shukra Vikara. Next please. Like Ashwagandha, it is effective in oligozoospermia. Next please. Shatavari, effective in oligozoospermia and ejaculatory dysfunction. It improves the nitric oxide pathway. Shatavari is not a female drug alone. Shatavari is a perfect drug for male sperm disorders and semen disorders. Next. And Kokilaksha Bijam, it improves the semen volume and count. Next please. In Gokshura is a definite testosterone-like action is shown in this Gokshura Kantakam. Spermatogenesis improves. Next please. Salam Panja, a Unani drug, it improves the semen quantity, quality, and erection. Next please. Mushali, Shweta Mushali and Krishna Mushali, they are effective for erectile dysfunction and premature ejaculation. Next please. Vidari Kanda is effective. Our DCGI director now, Rabinarayan Acharya, his clinical trial drug was this Vidari Kanda, and this is going to improve gonadotropin releasing hormone. GnRH will be improved by this. FSH LH in male. When FSH is low, sperm count is low. So FSH can be improved by Vidari Kanda. Next please. Kapikachu also improves the sperm count. It is dopaminergic drug. It also improves the count and quality. Next please. Estimadu is going to improve the quantity of the semen. If you want very whitish semen, if volume is less, give Estimadu Churna 5 grams twice a day with milk. Within a week, patient will have improvement in volume. Next. Bastandam. This Bastanda Prayoga we are doing. Bastanda Prayoga we are doing in Matra Basti. Bastanda Gruta we prepare and give it in Uttar Basti and oral drug. This Bastanda is also available in the market in the name of Rishavati by Satara Pharmacy. That is also going to work. Next please. Khade Kuman Gache Srinam Chatamurchitam. If you take Bastanda internally or correctly and you can do 100 time intercourse. So these are all problems and limitations in management of infertility, varicocele, azoospermia, retrograde ejaculation, genetic disorders, hypogonadotropic hypogonadism, hyperprolactinemia. They are all very difficult and tough to treat. You need special skills for that. Next please. With this, a carry home message is Shukram Tasmat Viseshena Raksham Arogyam Ichata. Please protect your semen. Means what? Use semen whenever you want for reproduction. Ayurveda says Sex is for not recreation. Sex is for reproduction. Whenever you are interested in reproduction, use the semen. Otherwise, don't use unnecessarily. Don't have uncounted sexual intercourse. Don't have sex with multiple partners. These are all the meaning of this. Shukram Rakshet means Shukra should be carefully used just like a bank balance. With this carry home message, last slide please. With this carry home message, I thank you one and all for taking much of your time. I thank all the ATA members and organizers for giving me an opportunity. Thank you one and all.
Thank you, sir. Thank you for a very elaborative, informative, and wonderful deliberation here. This session is open for question and answer period. If anybody have any question regarding the session, can come forward, please.
Namaste, Madhav sir. Indeed, it is evidence-based study. Thank you for this elaborate information. I just want to ask you one thing. You have stated usefulness of Chavanprasha. Is there any experience or specific condition, whether it is useful in Sarvadainik Shukradushti or whether it is useful in Penilam Tanu Rukshamcha? What is your experience? I would like to know that.
We definitely use free radical induced damage to the testis.
Okay.
So leading to oligoasthenoteratozoospermia or testicular germinal epithelium early failures. When you do the biopsy study, testicular biopsy, if it says maturation arrest up to primary spermatid level or up to secondary spermatid level, Chavanprasha definitely gives result.
Okay.
Second, Vatapittaja Shukradushti. Whenever we diagnose Hina Shukram, Vatapittaja Shukradushti, then Chavanprasha works. Then, when I normally prescribe this Chavanprasha when both male and female are having all reports normal, still infertility. It is called unexplained infertility. When hormones are normal, anti-sperm antibodies are normal, all reports are normal. When doctor says upside, then Chavanprasha for 3 months, Kalyanaka Vrita for 3 months, definitely gives result.
Okay. Thank you very much, sir.
Thank you. Very good question.
Thank you, sir. As we are running the session quite late, so quite sorry for the questions. I request Dr. Gaikwad, sir, chairman of this session, to focus on the speech today.
First of all, I am very much thankful. Association, Ayurveda Teachers Association, and this is the 4th National Conference of Evidence-Based Ayurveda. The opportunity that has given by the organizer, I am very much thankful to the organizer. Today, I am feeling very proud. In the auditorium, the eminent personality of Ayurveda field, Dr. Subhash Ranade is there, Dr. Mrs. Ranade is there. I am feeling proud. They are all my Gurujans, and I want their blessings for future life. So this is the August gathering of this seminar, and Dr. Madhav has elaborated everything, every aspect of Shukra and Shukra. And as the seminar is having title, Evidence-Based Ayurveda, Dr. Madhav has explained each and every aspect of this topic, field of andrology and the branch of Ayurveda, the special branch among 8 branches of Ayurveda, that is Rasayana and Vajikarana. He explained in a very well manner what is Rasayana, what is Vajikaran, and he also explained what kind of this Kasa analysis regarding semen analysis, and he had shown the 4 cases. One case is about Kshina Shukra, second is erectile dysfunction, third case is oligoasthenokeratosis, hernia. Fourth one was cleft, that is arterial insufficiency, which was diagnosed again by penile doctor study. As we know, the male factor is very much responsible for the case of infertility. And how it is difficulty we are facing each and every practitioner, how it is difficult to get the semen to be tested by the male person. It is very difficult to tell the patient that he is one of the part of this infertility case, and we have to investigate the semen analysis. So it is a crucial part to uh, do the lab test of semen analysis. Still, we are doing that. Dr. Madhav has already explained each and every aspect. The role of hypothalamus and pituitary, he has already explained about as in our ancient test, Tadeva Prakti Sansvarsha Darshanat Smaranat Granat. He also explained in the mental or manasik city, and in Charaka, Bhimana and different kind of state of mind that is explained in our text that should be considered while treating the infertility case. He also explained about the factors which are responsible for spermatogenesis, and again he has explained the modern part also, and with the help of diagram of sperm, he also elaborated how we investigate the doshas and Shukra Dushti and how we can treat this with the help of Ayurveda. Concept of Shukra he has already explained, and the goal of Ayurveda is, or the Vajikaran or Rasayan and Vajikaran also, or in case of Ayurveda, the goal is to achieve a Shreyasa Praja. Shreyasa Praja, that is the person who is having optimum level of Gunotkarsha. So we have to achieve this goal with the help of all these Ayurveda remedies which has been given in the text. So this was a very wonderful and very informative lecture that has been given by Dr. Madhav. I congratulate Dr. Madhav for this wonderful lecture. Once again, I am very much thankful to the organizer, the coordinator of this session, Dr. Gopal Jadhav, and my co-chairperson, Dr. Pradnya Madam, and all the gathered auspicious audience and members of this Ayurveda field. I am very much thankful once again. Thank you very much.
Thank you, sir. Now it's time to felicitate our honorable guest. I request Chairperson Dr. Gaikwad sir to felicitate Dr. Madhav sir. I request Dr. Arun Dugmal sir, working president of Ayurveda Teacher Association, to come on the dais and felicitate today's chairperson, Dr. Gaikwad sir. Dugmal sir. Dr. Anand sir. Dr. Anand Motagundi sir, treasurer, Ayurveda Teacher Association, will felicitate Dr. Manoj Gaikwad sir. Dr. Nitin Chandorkar sir, I request you to come on the stage and felicitate co-chairperson Dr. Pradnya Madam. Dr. Nitin Chandorkar sir. Thank you. Uh, Now it's time to present the vote of thanks. I thank the organizers for arranging this today's second session here, and the expert guest, Dr. Digavi sir, who has focused so many aspects of the male infertility and male sexual problems. I thank Dr. Manoj Gaikwad sir for being here and expertise his view on the guest lecture. I also thank Dr. Pradna ma'am for contributing her time in this session. I also thanks day coordinator and all organizers for giving me this opportunity and making this session successful. I'm going to hand over the session to day coordinator Praveen sir and Shilpa ma'am. Thank you.
Thanks. I request session coordinator, Dr. Gopal Jadhav sir, to please come on the stage. I request Dr. Revan Siddha Usturge sir, ATA life member, to please felicitate our today's session coordinator, Dr. Gopal Jadhav, for coordinating and conducting this session very nicely, very well. Thank you, sir. Thank you all. Now we were heading towards the very next important event of this fourth national conference, and that is the Ayurveda Teacher Association's National Award Distribution Ceremony. And to host this prestigious award ceremony, I invite Dr. Mrs. Vedika Praveen Sadhale, MD Ayurveda Samhita Siddhanta, Assistant Professor, Department of Samhita Siddhanta, Bharati Vidyapit University College of Ayurveda. I request Dr. Revan Siddha Usturge sir, Head of Department, Associate Professor Agat Tantra, SGRM Solapur. I handed over the sessions to Dr. Sadhale and Dr. Usturge. The ceremony will begin within a short time. Thank you.
Hello. It's request to all the dignitaries present in the hall. Please stay with us. We'll be back within few minutes. Just a few arrangement on the dais is going on.
Namaskar and good afternoon, one and all. It's honor itself to honor this wonderful audience who has gathered here for the fourth National Award ceremony of National Conference on Evidence-Based Ayurveda, accredited by Maharashtra University of Health Sciences, Nashik. I, Dr. Vedika Sadale, welcomes you all on behalf of Ayurveda Teachers Association for this award ceremony. Now I request to all our honorable guests to come upon the dais. I request Mananiya Amdar Jayant Azgaokarji, Dr. Suresh Patinkar, sir, our chief guest, Dr. Pro VC, Dr. Milind Nikumbu, sir, and all other dignitaries of Ayurveda Teachers Association, Dr. Rahul Suryanshi, President, National Ayurveda Teachers Association, Dr. Nitin Sandurkar, sir, Vice President, National Ayurveda Teachers Association, Secretary, Dr. Manoj Chaudhary, Treasurer, National Ayurveda Teachers Association, Dr. Anand Madhundi, Dr. Arun Dudhmal, Working President of Ayurveda Teachers Association, Dr. Ganesh Patil, Joint Treasurer, Dr. Pradeep Zondhare, sir, Executive Member of Ayurveda Teachers Association, Dr. Nitin Vagamare, Executive Member, Ayurveda Teachers Association, Dr. Sangram Keshri Das, President, Goa Ayurveda Teachers Association, Dr. Sandeep Zadhav, Executive Member, Ayurveda Teachers Association. I request all the dignitaries to please come upon this dais. A big round of applause. We have our guest with us. Before proceeding further, I request all the dignitaries present in the hall kindly switch off your mobile phones or to make it on silent mode. I request Honorable Dr. Saurikar sir, Honorable Dr. Ranade sir, to please come up on the stage. I again request all the dignitaries from Ayurveda Teachers Association, Dr. Rahul Suryanshi, President, Vice President, Dr. Nitin Sandurkar, sir, Secretary, Dr. Manoj Chaudhary, sir, Treasurer, Dr. Anand Madgundi, Working President, Dr. Arun Dudhmal, sir, Joint Treasurer, Dr. Ganesh Patil, sir, Dr. Pradeep Zondhare, sir, Executive Member, Dr. Nitin Vaghmare, Executive Member, Dr. Sandeep Zadhav, Executive Member of ATA. Welcome, ma'am. Welcome, sir. Moving forward, we will have our traditional auspicious lamp lighting ceremony along with the divine Mangalacharan as given by our Samhitas and our tradition. I request to all the dignitaries present on the dais to come forward for the lamp lighting.
दीपं ज्योतिः दीपं ज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपं नमोऽस्तु ते दीपं ज्योतिः दीपं ज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपं नमोऽस्तु ते सन्ध्यादीपं नमोऽस्तु ते दीपं ज्योतिः दीपं ज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपं नमोऽस्तु ते
Any Ayurveda conference or any study or any classroom, in fact, in a class, single class also is incomplete without the prayer of Lord Dhanvantari. So, of course, I request Dr. Manasi Borkar to come forward for the chanting of Holy Dhanvantari Stavan. Everyone is requested to stand for the Dhanvantari Stavan.
शङ्खं चक्रं जलौकां दधतमृतघटितं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृदयम् अंशुकपरिविलसन् मौल्यमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसन् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवन प्रौढदावाग्निनीलं प्रौढदावाग्निनीलम्
Thank you, Dr. Manasi Borkar, for bringing down Lord Dhanvantari's blessing on all of us. I request all the respected dignitaries to grace this occasion with the felicitation of our guest, Atiti Devo Bhava. First, I request Dr. Nitin Sandurkar sir, National Vice President, Ayurveda Teachers Association, to felicitate our distinguished guest, Honorable Dr. Suresh Patankar sir. Dr. Nitin Sandurkar sir, please. Our management strongly believes that felicitation is a way to show a great respect towards our Atithi. Dr. Nitin Sandolkar sir, felicitating Dr. Suresh Patankar sir, our chief guest of this program. Now I request Dr. Rahul Soyanshi sir, President Ayurveda Teachers Association, to felicitate the eminent personality, Honorable Pro Vice Chancellor of Maharashtra University of Health Sciences, Dr. Milind Nikombu sir. Volunteers, please be ready with all the things. Now I request Dr. Manoj Chaudhary, sir, Secretary Ayurveda Teachers Association, to felicitate our Sanmanini Amdar Jayant Asgaonkar sir. Dr. Manoj Chaudhary, Secretary Ayurveda Teachers Association, felicitating Amdar Jayant Asgaonkar sir. Thank you, sir. Thank you all dignitaries. I request renowned and favorite teacher of the students, Dr. Manoj Chaudhary sir, who is a National Secretary, Ayurveda Teachers Association, for the welcome speech about the program and about our guest.
A very warm good morning, actually good afternoon to all of you. I welcome all of you on behalf of Ayurveda Teacher Association. We have gathered here in Azadi Ka Amrut Mahotsav Parv for a memorable National Award Ceremony 2022 on occasion of 4th National Conference on Evidence-Based Ayurveda, which is accredited by Maharashtra University of Health Sciences, Nashik. Respected chief guest, who is always ready to help us, our well-wisher, member of Legislative Council, Pune Teacher Constituency, Honorable Mr. Jayant Aji Asgaonkar sir, our guest of honor for today's function, a very dynamic personality, Honorable Vice Chancellor of Maharashtra University of Health Sciences, Nashik. She is present online, a very keen researcher and a very disciplined administrator, retired Lieutenant General Madhuriji Kanitkar ma'am, an iconic, well-known Ayurveda pillar, ex-principal, professor, researcher, our beloved friend and now Pro Vice Chancellor of Maharashtra University of Health Sciences, Honorable Dr. Milinji Nikum sir, Member of Management Council, MUHS, Senior Urologist, Senior Researcher, Director of ACE Hospital, our guide and kind supporter of ATA from beginning, Honorable Professor Dr. Sureshji Patankar sir. For this function, we have a special presence of Honorable Principal of our Ashtanga Ayurveda College, Pune, HOD Sri Rog Prasuti Department, my senior colleague, Professor Dr. Gaukar ma'am. She is also observer on our conference on behalf of MUHS, a real hard worker and who is awardee for the special award, that is the Lifetime Achievement Award, Gujarat Ayurveda University ex-Chancellor, Vice Chancellor, MUHS Vice Chancellor, BHU, etc. all universities, the great researcher, the Rasashasravid, Pitamaha of Ayurveda fraternity, my guru and mentor, Professor Dr. Sriramji Savrikar sir, a real Karma Yogi, educationalist, researcher, a leader for aided Ayurveda colleges, ex-advisor of ISM&H Department, Delhi, Honorable Dr. Purushottamji Palekar sir. Due to health issue, he is not present here. A very famous and dynamic personality, my postgraduate guide, and a very well-known and in true sense, global ambassador of Ayurveda, who have traveled across all 5 continents many times and visited more than 77 countries for propagation of Ayurveda, Chairman of International Academy of Ayurveda, my guru, Professor Dr. Subhashji Ranade, and his better half. Without her support, it was not possible. That is Vice Chairman of International Academy of Ayurveda, Dr. Mrs. Sunandaji Ranade, all my respected colleagues, friends, sponsors, awardee professors, researchers, practitioners, and their family members and friends. All without which this function was not possible. All our ATA team, National President Dr. Suryavanshi sir, Vice President Dr. Sandurkar sir, Treasurer Dr. Anand Madgundi sir, and all our state and national office bearers, volunteers of ATA. 5 years back, we have started a journey that will lead to Ayurveda and Unani sciences progress in real mean. We have started working for welfare of Ayurveda and Unani in education field, especially practice, research, and updates. Ayurveda Teacher Association is a national level association of teachers working in all sectors such as private, deemed, aided, government, and Ayurveda and Unani colleges. Teachers are having a key role to develop the future careers of Ayurveda and Unani sciences. Teachers play a very important role in shaping the future of their students. Teachers are the medium to pass on the eternal knowledge of Ayurveda and Unani to future careers of sciences. Not only the teachers, but there we have almost all stakeholders from Ayurveda and Unani community, like teachers, researchers, practitioners, pharmacy entrepreneurs, administrators, PG scholars, UG scholars, and so on. If every one of us keep ourselves updated by sharing our knowledge through such conferences in a better way, we can give beautiful output to our respective fields. To update our Ayurveda and Unani community, ATA is making continuous efforts by organizing such conferences, webinars, competitions, clinical meetings, etc. This is our 4th national conference. This year, we have come with the theme Evidence-Based Ayurveda. Evidence-based Ayurveda practice is a hot topic for clinicians, students of Ayurveda, planners, patients, and public in large. We are having, the ATA is having nationwide almost branches in every state, especially in Karnataka, Kerala, Madhya Pradesh, Uttar Pradesh, Gujarat, Delhi, and Goa. Presently, we have 13 state units, 200 plus colleges which have members, 15,000 plus teachers are connected, and over 50,000 plus students in the form of ATS students wings. We are working on state level such as Medical Education Ministry, Ayush Ministry, NCISM, and Health Ministry on national level also. Here, ATA also followed the issues like time-bound promotion, the permission for in the form of gazette for various surgeries. ATA has received very positive response from all the authorities on state and national level in their output manner like gazettes. I am proud to say that because of the faith shown by all of you in ATA, the ATA is representing our DOS members in MUHS, RGUHS, KGUHS, being Teachers Association. ATA has successfully conducted many programs. This is one of it. Next, considering the need of genuine research journal, ATA has started own research journal, online research journal, that is AirJata. Dr. Kiran Tavlare and his team is looking after it. To thank, encourage, and appreciate the work in relevant fields of Ayurveda and Unani community, which are all the stakeholders such as practitioners, researchers, academicians, Lifetime Achievement Awards, the Global Ambassador Award, we are gathered here. I again welcome all of you and appeal you to take an opportunity to work together actively with ATA. Some people are purposely making confusions, spreading rumors in our community about ATA. But here I want to clear that ATA is not against any particular group, a particular person, a particular college, or any other thing. ATA doesn't favor any particular side of political parties. We have volunteers of all shades with us, and everyone is welcome to join. We just working honestly on reforms and welfare of Ayurveda and Unani sciences. Thank you. Jai Ayurveda, Jai ATA, Jai Unani. Thank you very much.
Thank you so much, sir. To run a national conference of this magnitude, a dynamic leadership and a guidance, special guidance is required. We have such a dynamic, respected Vice Chancellor, Madam, and Maharashtra University of Health Sciences, Dr. Madhuri Karnikar, Madam, with us. Madam is online, available now. I request our technical team to show.
Yeah. Am I audible? Hello.
Yes, ma'am.
Good afternoon to everyone. Am I audible?
Yes, ma'am, you are audible.
Yeah. Can I address people now, or what would you like me to do that now?
Yes, ma'am.
Okay. Yes. First of all, thank you very much for inviting me to be the chief guest today. And my apologies for not being able to be there in person because we had a big function here at the MUHS for the 15th August, and there were other commitments that I had today. But I compliment you all for this evidence-based Ayurveda conference and national award ceremony that you are holding today. And it is my proud privilege to be here. Dr. Jayant Asgaonkar, Dr. Suresh Patankar, Dr. Milind Nikum, all the others, dignitaries on the dais, off the dais, all the teachers and delegates attending this conference. It's really a proud privilege to be addressing you all. My special compliments to the two lifetime awardees for today, Dr. Shriram Savrikar and Dr. P.P. Palekar. Both of them, I know, have contributed a huge amount to the education and propagation of research in Ayurveda. Today, I'm extremely happy that MUHS is with the Teachers Association and is really keen take Ayurveda education in our state to the next level. I firmly believe that health should not be fragmented into pathies. Health should be integrated and the care of patient should be the common goal of all working together. Now, for this, over the years, what Ayurveda has lost to modern medicine, it is our combined duty to bring it together. And a huge responsibility rests on the teachers of the Ayurveda fraternity, because it is you who will guide the students and let the university know. It is a real proud moment for me that my pro-vice chancellor is from the Ayurveda faculty and has been a dean, an experienced person. And I have some very important people like Dr. Savrikar, Dr. Patankar with a base in Ayurveda and so much of collective experience to guide us to take this further. We look forward to a day where we can have an integrated curriculum as we put in our vision document for a family medicine course, and we can have a school of integrated medicine where modern medicine and Ayurveda will work together along with our other Ayush systems. And the patient it will be patient-centric and we will have to work hard together. This cannot happen unless we have evidence-based recommendations and standard treatment guidelines prepared by you all teachers, verified by your council and accepted by Ayush, which come in strongly to prepare an integrated curriculum. Especially, I'm very sure that Ayurveda has answers to better preventive care, better promotive care, better answers to chronic conditions, to pain management, rehabilitation, and palliative care. So that I think if we can work together for emergency care with modern medicine, that is what India will have to offer to the world. But for that, we need strong grassroots evidence-based practice. So what was known as traditional knowledge to be acceptable to the world, we have to use modern technology, modern methods, and also our strategies, markers to show how this works at the molecular level. Because molecular and genetic methods are being taught today, but Ayurveda practiced precision and individualized medicine for years together. We have to speak the language that the world will accept. And towards this, I thought the teachers would be the first people who would help MUHS to work through the students. So when you think of today, we are having maximum number from the Ayush and especially Ayurveda who follow PhD. But each one is doing a small portion which may not really contribute to world literature or evidence-based practice. So we need to have the bigger picture in mind and enable our students. Towards that, I'm very happy that this year onwards, we have going to have basic courses for all people who qualify to do a PhD under MUHS. To improve the standard of the thesis and the doctorate studies that they will undertake, every student will have to undergo a advanced research methodology along with their guide, which was anyway in vogue. Besides this, they will have to choose based on their area of interest one of the 3 workshops, and we would be happy to add more if we get feedback from you all. But to begin with, we've taught molecular and genetic methods, a course on orientation course on drug standardization, and an orientation course on animal handling, both small and large, would be taught to all the PhD students. The second will have to be a choice from among what they would like to pursue. This will give them a better ground strength to plan their thesis topic, and thereafter the monitoring would be strictly done through a doctorate committee to avoid delays and ineffective work. I think if the college, university has to give a degree, it has to be of a very high standard. So these are just some of the early things that we have to collectively at the MUHS been thinking about. And I'd be very happy if the teachers and the advisors and like the today's awardees really guide us as to how to take our vision to the next level. So I really rely on you all, and I hope that we can work together in partnership. And with that, I wish this conference all the best, and I'm sure you will come out with some very good ideas and guidelines, and I will be taking a personal feedback from my Pro Vice Chancellor who's attending this meeting. Thank you very much, and Jai Hind.
Thank you, ma'am. Thank you so much. Madam has addressed the important interdisciplinary approach or multidisciplinary approach, integrative approach in Ayurveda and other systems of medicine for the welfare of society, for the welfare of the patients. Tasmat Aturam Putrivat Acharet. So we will definitely follow this, ma'am, and will definitely try. Our next generation definitely will follow this path of research and evidence-based Ayurveda medicine for the same. Thank you, ma'am. Thank you so much. So moving forward, I request our dynamic leader, Dr. Rahul Suyanshi, sir, National President of Ayurveda Teachers Association, for his presidential note.
Thank you, ma'am. Very good afternoon to honorable guest, VC ma'am, dynamic that she's give us very detailed discussion, जिसे little address बोलेंगे हम उसको, कि जिन्होंने रिसर्च के बारे में और आयुर्वेद के बारे में अच्छे हमें सलाह दी। हम बोलते हैं कि अभी हमारे डिस्कशन हुई निकुम सर के साथ पिछली बार जो हमारे इनॉग्रेशन हुआ, उस इनॉग्रेशन में ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेद के डायरेक्टर तनुजा नेसरी मैम भी थी, उन्होंने भी बोला था दिस इज नाउ गोल्डन एरा ऑफ आयुर्वेदा। सच में वही बात है कि जो हम ऊपर से नीचे तक अगर देख लिए, आयुष मिनिस्ट्री फॉर्म हो गई है, सम्माननीय पंतप्रधान नरेंद्र जी मोदी जी ने आयुष मिनिस्ट्री फॉर्म करने के बाद जो अभी व्यासपीठ पे उपस्थित डॉक्टर सावरीकर सर है, पाटनकर सर है, सेशन के एडवाइजर रह चुके हैं, काम कर रहे हैं, उससे एक अंदाज आ जाता है कि सच में आयुर्वेद के लिए एक गोल्डन एरा आ चुका है। एज अ स्टेक होल्डर्स ऑफ आयुर्वेदा वी ऑल शुड टेक पार्ट इन इट एंड उसका बेनिफिट हमें उठाना चाहिए। वेरी गुड आफ्टरनून टू ऑल ऑनरेबल गेस्ट, डॉक्टर प्रोविसी निकुम सर हमारे कहने पर हमेशा हमें पॉजिटिव सपोर्ट करने वाले, टीचर एमएलसी माननीय जयंत असगावकर सर, वेल नोन यूरोलॉजिस्ट जिन्होंने बीएमएस करके फिर एमबीबीएस, एफआरसीएस, एमएस वगैरह किया है, और ही इज ऑलवेज इन दिस एरा, इन दिस एज आल्सो ही इज वर्किंग फॉर आयुर्वेदा एंड रिसर्च इन आयुर्वेदा। लास्ट ईयर मुझे बहुत खुशी हो रही है, इसी ऑडिटोरियम में 3 साल पहले हमारी पाटनकर सर की और मेरी मुलाकात हुई थी, और मैंने दूसरे कार्यक्रम की वजह से उनको बात की थी, और हमने जस्ट बताया था कि सर हम अपडेट इन आयुर्वेदा कॉन्फ्रेंस देने जा रहे थे। सर ने मुझे पकड़ के बोला, सर आई वांट टू एड्रेस इन दैट अपडेट इन आयुर्वेदा, दैट रिसर्च इन आयुर्वेदा कॉन्फ्रेंस। तो ये बात बता दें पाटनकर सर आयुर्वेद में कितने दिलचस्पी रखते हैं और रिसर्च में कितनी दिलचस्पी रखते हैं। सावरीकर सर तो ऑलवेज हमें सपोर्ट करते हैं, हमें एनकरेज करते रहते हैं। डॉक्टर सुभाष रानडे सर है, सुनंदा रानडे मैम यहाँ है, हमारे सब नेशनल एग्जीक्यूटिव डॉक्टर नितिन चांदोलकर सर, डॉक्टर मनोज चौधरी सर, दुधमल सर, डॉक्टर वाघमारे सर, ट्रेजरर हमारे डॉक्टर मधुनी सर, जोंदड़े सर, तलोड़े सर, सतीश जादव सर, गोवा से आए हुए अमरकेश दास, ATA प्रेसिडेंट. This is an occasion of joy for all of us. We have come together for 4th national conference, that is evidence-based Ayurveda and national award ceremony. This goes without saying that the award ceremony is amongst my most treasured occasions of the ATA, as it provides us with an opportunity to reflect on the preceding year, address the whole community and share the achievements, success of the plans of our ATA for the dip of the come. Our ATA truly believes that good education plays a crucial role in building a bright future for our Ayurveda. Therefore, here we are committed to providing an atmosphere to our students where they all can emit good values and learn new things every day. इसमें एक शेर मुझे याद आता है, शिक्षक की वैल्यू क्या हो सकती है. शिक्षक और सड़क दोनों एक जैसे होते हैं, खुद जहाँ है वही रहते हैं, मगर दूसरों की उनकी मंजिल तक पहुंचा ही देते हैं. I am extremely glad as the fact that our ATA committee members as well as teachers and leaders, no stone unturned in working towards the directions award are a way of to encourage good behaviors and inculcate competitive spirit. This is the reason why our ATA organizes an award ceremony every year. इस साल हमने अवार्ड सेरेमनी में UG PG अलग सा कैटेगरी कर दिया है, क्योंकि बहुत बार ऐसा होता है लास्ट 3 years वी आर सीइंग दैट PG जिस कॉलेज में है, जिस इंस्टीट्यूट में, उस टीचर का बायोडाटा ज़्यादा अच्छा रहता है, क्योंकि पेपर प्रेजेंटेशन, पोस्टर प्रेजेंटेशन, PhD वगैरह उनका बायोडाटा है. तो एक अवार्ड सेरेमनी का उद्देश्य ये है कि हमारे जो टीचर्स काम करते हैं उनको इनकरेज करना, यही उद्देश्य है. तो पिछले साल तक हम हर एक सब्जेक्ट से एक टीचर को लेते थे. फिर कुछ UG कॉलेज से हमें फोन आने लगे, सर अगर ऐसा रहा तो हमारा तो बायोडाटा या रिज्यूम बहुत मार्किंग सिस्टम से बहुत कम रह जाएगा. क्योंकि कैसा है, हमारे जो ट्रांसपेरेंटली जितने रिज्यूम्स हमें आ जाते हैं, जितने नॉमिनेशंस आते हैं, उनके ऊपर हम 3 लोगों की कमिटी बिठाई जाती है और वो कमिटी मार्किंग सिस्टम के ऊपर वो मार्क देने पर वो अवार्ड दिया जाता है. जब UG टीचर्स के यहाँ अगर PG के लिए कोई एनवायरनमेंट नहीं है तो उनके रिसर्च पेपर या कुछ PhD PG स्टूडेंट्स कम हो जाते हैं. तो उसके लिए इस साल से हमने 2 अलग कैटेगरी कर दी कि UG टीचर, PG टीचर. एंड बहुत सारे इमर्जिंग टीचर भी, नए टीचर भी बोल रहे थे, सर अगर ऐसा रहा तो हम 15-20 साल तक ऐसे ही रहेंगे, हमें कब अवार्ड मिलेंगे. तो वो बात ध्यान में रख के हमने इमर्जिंग टीचर ये भी कैटेगरी रख दी है. उसमें 3 से 7 साल तक जिस टीचर का एक्सपीरियंस है बट ही इज एक्टिव, एंड वही मार्किंग सिस्टम में उसने रिसर्च पेपर, पोस्टर पेपर और अदर एक्टिविटीज कितने किए, उसके ऊपर हम ये अवार्ड देते हैं. तो हमारा उद्देश्य है कि हर एक को एनकरेज कर दिया जाए. मैंने पिछले साल एक टीचर को अवार्ड हमने डिक्लेअर किया और मैंने फोन किया, सर यू आर सिलेक्टेड एज अ बेस्ट टीचर अवार्ड. तो सर के मन में इतना आया की सर बोला, अरे सर मैं अभी आता मी ह्याच्यातून कंटाळलोय, मला आता नको नको झालंय आयुर्वेदातल्या गोष्टी बघून वगैरे. पण नाही म्हटलं, सर आपण आता चांगले लोक आहोत, आपण चांगले लोक एकत्र करतोय, काय चांगल्या गोष्टी घडवतोय, वातावरण पण चांगलं होतंय, तर त्याच्यासाठी आपल्याला करायचं नाही रे. आता मी सर म्हटले, मला ऍक्च्युली महाराष्ट्रीयनच होते त्यामुळे मराठीत बोलले, नाही रे मला आता कंटाळा आला, आता हे वातावरण बघितलं मला कसं तरी होतंय, मी आता रिटायर होतोय, त्यामुळं काहीच नाही. नाही सर म्हटलं, तरी तुम्हाला यावं लागेल, आम्ही देतोय, आणि तुम्हाला जो कंटाळा आला, निगेटिव्हिटी जी झालेली आहे तीच आपल्याला दूर करायची. आणि आपण ATच्या व्यासपीठाच्या माध्यमातून ही जी निगेटिव्हिटी किंवा जो नैराश्य जे आलेलं आहे ते आपल्याला दूर करायचं आहे. आणि खरंच मग त्यांना मी सर म्हटलं, तुम्हाला यावं लागेल, हे अवॉर्ड घ्यावं लागेल. मग त्यांची पहिली प्रतिक्रिया होती, खरंच तुझ्या तोंडून देव बोलला, माझ्या मनात जे होतं ते आजपर्यंत मी एवढं वर्ष काम केलं, ते खरंच ती व्यक्ती जी होती ती हुशार होती, आणि आयुर्वेदात कोणीही म्हणणार नाही की त्या व्यक्तीचं कामाबद्दल दुमत असेल. आणि ते म्हणले की सर तुमच्या तोंडून देव बोलला, मला खरंच आता कुठेतरी एक तर ऍप्रिशिएशनची आवश्यकता होती, आणि त्या गोष्टी या ATच्या व्यासपीठावरून होत आहेत. In last 4.5 years, we are doing this work for the quality education. First conference we are organized on the teacher issues and quality education. Second conference, day by day, we are improving our conferences. That conference, first conference for 1 day. Second conference was research in Ayurveda. In that conference, हमने पहली बार बेस्ट टीचर अवार्ड सेरेमनी शुरू कर दिया. थर्ड कॉन्फ्रेंस में हमने अपडेट इन आयुर्वेदा, यानी जो रिसर्च के लिए जो जरूरी है, अपडेशन क्या है उसके ऊपर रिसर्च हो सकता है. तो पहला हमारा थीम की रिसर्च इन आयुर्वेदा, वी टू अपडेट इन आयुर्वेदा. नाउ दिस 4th नेशनल कॉन्फ्रेंस इज रिगार्डिंग एविडेंस बेस्ड आयुर्वेदा. और इसका रिस्पॉन्स अगर देख लिया जाए, पहले कॉन्फ्रेंस में हॉल छोटा था, सिर्फ टीचर्स के लिए हमने बुलाया था, अराउंड 250-300 टीचर्स ऑल ओवर महाराष्ट्र से आए थे. सेकंड कॉन्फ्रेंस में रिसर्च इन आयुर्वेदा अराउंड 1200 teachers and students participated in that conference. And last year conference, which was research in Ayurveda, evidence-based Ayurveda, around 3,500 delegates participated in that conference. आज की बीच conference है, around 1,500 delegates are looking on YouTube and Zoom link in this conference. हमने जो भी कोई संगठन होती है, एसोसिएशन होती है, तो बहुत सारे लोगों को लगता है कि एसोसिएशन हो गए तो कुछ तो डिमांड करेंगे, कुछ ये करेंगे, वो करेंगे. तो दिस एसोसिएशन का पहला उद्देश्य क्वालिटी एजुकेशन. हमने हर बार मैं हर स्टेज पे यही बोलता हूँ कि हमारे कॉन्फ्रेंस, हमारे एसोसिएशन जो है, दिस इज क्वालिटी फॉर ओनली फॉर क्वालिटी एजुकेशन. उसके बारे में आपने देख लिया. तो कॉन्फ्रेंस हम ऑर्गेनाइज करते हैं. वेबिनार जो 2 साल कोविड था, उसमें अराउंड 30 से 40 वेबिनार्स हमने ऑर्गेनाइज किए थे. उसके बाद पिछले कॉन्फ्रेंस में कुछ हमारे दोस्त, हमारे एग्जीक्यूटिव बोले कि अरे हमें स्टूडेंट विंग भी शुरू करने का, क्योंकि दैट इज द पार्ट ऑफ आवर क्वालिटी एजुकेशन. हम सिर्फ टीचर के लिए काम करें तो स्टूडेंट को भी साथ में लेना इज द मेजर पार्ट. तो हमने पिछले साल संकल्प किया और पिछले धन्वंतरी जयंती के दिन दिवाली में हमारा स्टूडेंट विंग भी फॉर्म हो गया. स्टूडेंट विंग के थ्रू अराउंड 2000 स्टूडेंट्स हमें कनेक्ट है ऑल ओवर महाराष्ट्र से. अभी आउट ऑफ महाराष्ट्र कुछ स्टूडेंट एक्टिविटी काम कर रहे हैं. उसमें हमारे मेंटोर डॉक्टर गौरव सावरकर वर्धा कॉलेज से है. ही इज वाइस प्रिंसिपल एंड एक्चुअली ही इज मेंटोरिंग दैट स्टूडेंट विंग. डॉक्टर कृष्णा देवकर वहाँ के प्रेसिडेंट है स्टूडेंट विंग के. तो उनके थ्रू हमने करियर अपॉर्चुनिटीज आफ्टर BMS, PG प्रिपरेशन, हाउ टू प्रिपेयर फॉर द PG एंट्रांस आफ्टर BMS. देन रिसर्च जो है, रिसर्च के बारे में हमने 10 लेक्चर की सीरीज भी ली. उसको भी बहुत अच्छा रिस्पॉन्स स्टूडेंट की ओर से मिला. तो मेरा कहने का मतलब यही है कि वी आर डूइंग नॉट डिमांडिंग, वी आर डूइंग फॉर द क्वालिटी एजुकेशन ऑल्सो. मुझे कहने में बहुत अभिमान हो रहा है. 4 साल पहले हमने एसोसिएशन, 4.5 साल पहले हमने एसोसिएशन फॉर्म किया. उसके बाद 5-6 महीने में ही अपने CCIM के प्रेसिडेंट डॉक्टर जयंत देव पुजारी सर नियुक्त हुए और उनके साथ हमने बात करने की डिमांड की कि सर हमें आपके साथ बात करनी है. आपका 1-to-1 इंटरेक्शन टीचर्स के साथ होना चाहिए. तो बहुत सारे प्रॉब्लम्स आते हैं. और सेंट्रल काउंसिल क्या करे, टीचर स्टूडेंट में ही बहुत सारे प्रश्न रहते हैं कि सेंट्रल काउंसिल क्या कर रही है, क्या. तो हमने सर को दरखास्त की, सर ने मान लिया. तो हमारे नागपुर में मीटिंग हुई. 1-to-1 इंटरेक्शन, CCIM क्या कर सकते हैं और टीचर की क्या डिमांड है. तो उस इंटरेक्शन में जो हमने मुद्दे रखे थे उसमें से 70% मुझे कहने में बहुत अभिमान है. और देवपुजारी सर का मुझे अभिमान है. वही मैं बोला गोल्डन ईयर आ रहा है, ऊपर से नीचे तक सभी गुड पीपल्स आर डूइंग देयर. तो हमने जो डिमांड्स रखे उसमें 70% डिमांड्स आर फुलफिल्ड इन दिस NCISM गैजेट. NCISM गैजेट में उसमें से 70% डिमांड्स फुलफिल हो गए. और उसके बाद जो 4 साल पहले मीटिंग हुई, उसके बाद हमारे 3-4 बार मुलाकात हुई. उससे हर मुलाकात में मैं सर के पास जाता था. सर बोलते थे अरे मैं जब भी दिल्ली जाता हूँ तुम्हारा डिमांड लेटर ATA का मेरे साथ रहता है. उसमें से ज्यादा पॉइंट में कैसे फुलफिल करूँ वही मैं देखता रहता हूँ. और गैजेट में वो दिखने को हमें मिला. उसमें से कुछ बातें और भी डेवलपमेंट इज क्या बोलते हैं, विकास जो निरंतर चलने वाली प्रतिक्रिया है, उसमें से कुछ बातें रह गई वो मैं यहाँ रखना चाहता हूँ. नेशनल इंस्टीट्यूट हर एक स्टेट में होना चाहिए, यही हमारी डिमांड थी. और जो आयुष मिनिस्ट्री है, आयुष मिनिस्ट्री का 20 to 25% जो बजट है वो एक्सक्लूसिवली एजुकेशनल पर्पस पे खर्च होना चाहिए. अगर ऐसा हो गया, जो ऑल ओवर इंडिया में जो अच्छे इंस्टीट्यूट्स है, आयुर्वेद इंस्टीट्यूट है, आयुर्वेद कॉलेजेस है, वहाँ अगर हम एजुकेशनल पर्पस से अगर वो पैसा अगर दे देते हैं तो इंस्टीट्यूट अच्छे हो सकते हैं, वहाँ के टीचर स्टूडेंट अच्छा सीख सकते हैं. तो हर एक स्टेट में नेशनल इंस्टीट्यूट होना चाहिए. महाराष्ट्र के बारे में अगर मैं बोल दिया था, यहाँ हमारे आमदार, शिक्षक आमदार असगावकर सर है, मैं उनको बोलूँगा अभी कल से विधानसभा का अधिवेशन है, उसमें अगर आपने रख दिया कि हर डिस्ट्रिक्ट में एक स्टेट आयुर्वेद कॉलेज होना चाहिए. गवर्नमेंट का आयुर्वेद कॉलेज अगर हर डिस्ट्रिक्ट में होता है तो जैसा केरला में आयुर्वेद बढ़ रहा है वैसा महाराष्ट्र में बढ़ने में कोई दिक्कत नहीं होगी. हमें अभी लगता है कि अराउंड ओनली 6 to 7 कॉलेजेस स्टेट गवर्नमेंट के है महाराष्ट्र में. अगर हर एक डिस्ट्रिक्ट में होता है तो निश्चित रूप से आयुर्वेद को अच्छे दिन आएंगे और बढ़ेंगे. और एक बात मैं हमेशा कहता हूँ कि सुपर स्पेशलिटी, कल भी अपनी इनॉग्रेशन सेरेमनी में मैं यही बात की कि अगर कोई चीज अगर डेवलप करनी है तो उसके माइक्रो लेवल पे हमें जाना पड़ता है. अगर हम मॉडर्न साइंस में गए, पेडियाट्रिक एक सब्जेक्ट है, पेडियाट्रिक में नियोनाटोलॉजिस्ट है, पेडियाट्रिशियन है, पीआईसी चलाने वाला अलग है, पेडियाट्रिक सर्जन अलग है, पेडियाट्रिक ऑर्थोपेडिक अलग है। यानी एक ब्रांच बोले तो उसमें 5, 6, 7 सुपर स्पेशलिटी आ जाते हैं उसमें। और मुझे खेद है कि आपने आयुर्वेद में शाला के अंदर एक सब्जेक्ट है, उसमें ईएनटी और ऑप्थेल्म बोथ है, और पीजी अगर करता है उसको भी अगर समझ में नहीं आता मैं ऑप्थेल्म में काम करूँ या ईएनटी में काम करूँ। इतने साल के बाद फिर भी हम अभी तक सुपर स्पेशलिटी तक नहीं गए। अगर हमारे इस कॉन्फ्रेंस के अगर आपने सब्जेक्ट देखे 15 टॉपिक देखे तो देर आर वांजरखेड़कर सर यहाँ आए, उन्होंने ऑन्कोलॉजी में बात की, ही इज आयुर्वेद फिलो, तो इतना अच्छा काम कर रहे हैं दिनाथ मंगेशकर में। तो अगर ऐसे सुपर स्पेशलिटी हमारे आयुर्वेद में अगर डेवलप कर, मेरे ख्याल से बहुत अच्छा डेवलप हो जाएगा। रिगार्डिंग और एक बात थी करियर एडवांसमेंट स्कीम, यहाँ निकुम सर है, उनको मैं वह बात बताना चाहता हूँ। हमने वीसी मैम ने डायनेमिक पर्सनैलिटी हमने डिमांड की थी उनके साथ मीटिंग के लिए अराउंड 2.5 आवर, 2.5 घंटा मैम ने हमारे सभी पॉइंट्स पे डिस्कशन किया था, उसका हमें फीडबैक भी आया। उसमें एक बात हम लेकिन जरूर रखना चाहते हैं कि करियर एडवांसमेंट स्कीम जो है फॉर ऑल टीचर्स, अराउंड 75% टीचर्स आर अफेक्टेड बाय दैट। हर एक क्षेत्र में करियर एडवांसमेंट स्कीम है, लेकिन सिर्फ आयुर्वेद में अपने क्षेत्र में करियर एडवांसमेंट स्कीम नहीं है। यूनिवर्सिटी को हमने डिमांड की है, लेकिन यूनिवर्सिटी ने हमें सिर्फ यही आंसर दिया कि दूसरे कौन से मेडिकल यूनिवर्सिटी में है वो हमें बताए। तो प्रोविसी साहब से मुझे यही विनती है कि अगर करियर एडवांसमेंट स्कीम अगर लग जाती है इमर्जिंग टीचर से सीनियर टीचर तक सभी को उसका फायदा हो सकता है और उनको भी काम करने के लिए थोड़ा सा बढ़ावा मिल सकता है। तो दैट शुड बी, I hope these demands will fulfill in next few days, few months. I express my heartiest gratitude to all my teachers, my committee members, students for their support for this collective efforts for this successful conference and this award ceremony. और सभी अवार्डीज को मैं अभिनंदन करना चाहता हूँ। और हम सब एक, मैं हर बार बोलता रहता हूँ, अभी यूनिवर्सिटी में निकुम सर की जब प्रोविंसिपल के निवड़ हो गई थी तब भी उस टाइम उनके साथ मैंने फोन पे उनका अभिनंदन किया था। सर आधा पौन घंटा मेरे साथ बात कर रहे थे। हमारा यही कहना मेरा हमेशा रहता है कि अच्छे लोग अगर इकट्ठा हो जाते हैं तो नेगेटिव थिंग्स ऑलवेज गोज बैक। अभी तक ऐसा थोड़ा सा नैराश्यपूर्ण वातावरण था, लेकिन यंग पीपल आर कमिंग अहेड व्हिच आर वेरी ट्रांसपेरेंट। उनके मन में क्या करना है क्या नहीं करना क्लियरली ट्रांसपेरेंट है। तो अगर हम स्टूडेंट वेलफेयर पे भी अपने मोरे सर, मनोज कुमार मोरे सर, आयुर्वेद के लोग अभी यूनिवर्सिटी में अच्छे से काम कर रहे हैं, पाटनकर सर मैनेजमेंट काउंसिल में है, अपने साविकर सर मैनेजमेंट काउंसिल है, सभी को आयुर्वेद के बारे में बहुत लगाव है। तो हम सब अगर इकट्ठा होकर अच्छा काम करेंगे तो निश्चित रूप से एक अच्छा काम यहाँ हो सकता है। थैंक यू। जय आयुर्वेद, जय टी।
Thank you, sir, for your valuable guidance. Tamasoma Jyotirgamaya. Sir has presented the elaborative view of Ayurveda Teachers Association and all other requirements and demands which are up in upcoming generation in his very brief words. Thank you, sir. Thank you once again. Awards are the way to encourage the desired behavior and inculcate the competitive spirit. It also inspires the next coming generation, spread inspirational golden path for the upcoming pathfinders. So let's give a big round of applause to our dignitaries first. In recognition of their exceptional achievement, superior dedication, and great contribution in the field of Ayurveda, I take this privilege to confer the Ayurveda Teachers Association's Lifetime Achievement Award to Honorable Dr. Sriram Savrikar, sir. I request all the dignitaries to please come forward for this award. I request Dr. K.T. Bharti Madam for the citation of this award. Dr. K.T. Bharti, Regional Coordinator, Centralized Zone, Pune.
Proud to present Lifetime Achievement Award of Excellence to you, Professor Dr. Sriram. Professor Dr. Sriram Sheshgir Savrikar for your contribution to the field of Ayurveda. Sir, you are a renowned professor of Shastra with more than 40 years experience of teaching Ayurveda in universities and various academic institutes. Sir, you are a renowned academician, researcher, and administrator in the field of Ayurveda, holding MD Ayurveda postgraduate degree in subject of Shastra, Vaishajya Kalpana from Mumbai University, with PhD in Ayurveda from SRT Marathwada University, Nanded. Recognizing your academic excellence, effortless work, and dynamic leadership, you have been appointed to various administrative positions in central and state governments. These positions include highest administrative post of advisor Ayurveda in the then Department of Indian System of Medicine and Homeopathy, ISM&H, presently known as Ministry of Ayush, Government of India, New Delhi, and highest academic position, Vice Chancellor, Gujarat University, Gujarat Ayurveda University, Jamnagar, Gujarat. You were also appointed as personal advisor to Ministry of Ayush, Government of India, and Ministry of Medical Education, Government of Maharashtra. Sir, you have been a key person in the development and preparation of monograms of Rasamanikya prepared by CCRAS. You have to your credit books such as Sharayu, an English commentary on Charanga Samvita in 3 volumes, Prasad Chandosha and Ayurveda Shanika Shastra, and your research focused on preparation and standardization of Anutaila, Gugula, Tamra Basma, and Budichi Grita. You have actively contributed to the preparation and development of monograms for Ayurvedic Pharmacopoeia and Formulary as a member of Ayurvedic Pharmacopoeia Committee. You were instrumental in preparing and developing good manufacturing practices for Ayurvedic pharma industry. You were nominated by various authorities and bodies in government, administration, and various universities for your effortless devotion, selfless academic contribution, dynamic leadership provided for promotion and progress of Ayurveda. You have been privileged to present Government of India at Port of Spain, Trinidad, Tobago as an expert in Ayurveda. You have addressed international seminars on Ayurveda in Mahindra Institute, Bristol, Germany. You have contributed to WHO consultancy on phytotherapy as WHO invited expert on Ayurveda in Milan, Italy. Sir, you are a renowned orator, particularly known for your clear vision, straightforward analysis and assessment of Ayurvedic classics. You have been invited to deliver your studious speeches on various national and international platforms and high-profile institutes like All India Institute of Medical Science, New Delhi, All India Institute of Ayurveda, New Delhi, Banaras, Hindu University, Varanasi, Gujarat Ayurveda University, Jamnagar, National Institute of Ayurveda, Jaipur, and many others, including international conferences like International Conference of Pharmacovigilance and conferences in cosmetics. Your contribution in academic reforms include laying down the foundation of examination reforms in MHS, Gujarat Ayurveda University, and contribution in preparation and development and restructuring curriculum and syllabi for Ayurveda, graduate and postgraduate courses as a member of CCIM, New Delhi. Sir, you are a recipient of many awards and honors, including Lifetime Achievement Award, Wadekar Award, Sundarlal Joshi Award, Nagindas Shah Astam Award for contribution in Shastra, Medscape National Award for Excellence in Ayurveda, with the D.V. Shende Rasa Aushadhi Award, Award for Pranachaya degree by Ayurveda Mahasammelan, New Delhi, late Hirandanath Datta Gupta Memorial Oration by East India Pharmaceuticals, Kolkata, and many such more. Congratulations on this astonishing endeavor, and may the Almighty give you many more and healthy, active life to contribute to the field of Ayurveda. Thank you. Congratulations once.
या ठिकाणी मला एक वाक्य बोलायचं आहे, तर आपली परवानगी असेल तर. अवॉर्ड जेव्हा दिलं जातं त्या व्यक्तीचा आपण गौरव करतो, असं आपण समजतो. तर मला असं वाटतं की सावरेकरांचा जो आपण गौरव केलाय त्याच्यामुळे ह्या लाईफ टाईम अवॉर्डचा गौरव झाला असं मी समजेल. आणि ही लाईफ टाईम अचिव्हमेंट म्हणजे खरोखरच आयुर्वेद टीचर्सनी केलेली आहे. त्यांची एक मोठी अचिव्हमेंट असं मी म्हणेन. सर तुम्ही एवढी अचिव्हमेंट अवॉर्ड मिळवलेली आहेत. मला वाटतं हे वी आर भाग्यवान आहोत की ह्या अवॉर्डची शान म्हणजे पुढच्या येणाऱ्या लोकांना अवघडच केलं असं म्हटलं तरी चालेल. धन्यवाद.
सभागृहात उपस्थित असलेल्या सर्वांना विनंती आहे की आपल्या जागेवर उभे राहून आपण सरांना मानवंदना द्यायची. ऑल आर रिक्वेस्टेड टू स्टँड. गिव्ह अ स्टँडिंग ओवेशन सर. Thank you, one and all. Thank you all the dignitaries present on the dais. Moving further, our next Lifetime Achievement Award goes to Dr. Paikar sir. Due to some health reason, sir is unable to receive this award. So I request Dr. Mohan Yande sir, State Organizer, Ayurveda Teachers Association, to receive this award on behalf of Dr. Paikar sir. Simultaneously, I request Dr. Nitin Sandurkar sir, Vice President, Ayurveda Teachers Association, for the citation of this award.
आयुर्वेद टीचर असोसिएशन जीवन गौरव पुरस्कार सन्मान पत्र प्राध्यापक डॉक्टर पुरुषोत्तम पुंडलिकराव पाळीकर सर. आयुर्वेद टीचर असोसिएशन आयुर्वेद क्षेत्रातील योगदानाबद्दल आपल्याला डॉक्टर पुरुषोत्तम पुंडलिकराव पाळीकर यांना जीवन गौरव पुरस्कार प्रदान करण्याचा अभिमान वाटतो. सर आपण बालरोग विषयाचे विख्यात प्राध्यापक आहात. आपण मुंबई बोर्डामधून AFM ही डिग्री प्राप्त केलेली आहे. आपणास नागपूर विद्यापीठ आणि अमरावती विद्यापीठामध्ये विविध शैक्षणिक संस्थांमध्ये आयुर्वेद शिकवण्याचा जवळपास 40 वर्षाहून अधिक अनुभव आहे. आपले शैक्षणिक नैपुण्य, उत्कृष्ट नेतृत्व गुण आणि सहज कामाची दखल घेऊन राज्य सरकारामधील विविध प्रशासकीय पदावर आपली नियुक्ती करण्यात आली आहे. एक प्रतिष्ठित शिक्षण तज्ञ, शिस्तप्रिय आणि कार्यक्षम प्रशासक आपण श्री गुरुदेव आयुर्वेद महाविद्यालय गुरुकुंज मोजरी, आरोग्य विभाग प्रमुख, अखिल भारतीय श्री गुरुदेव सेवा मंडळ गुरुकुंज आश्रम जिल्हा अमरावती यांचे प्राचार्य होता. डीन व सिनेट सदस्य, अध्यक्ष अभ्यास मंडळ नागपूर विद्यापीठ नागपूर, डीन आयुर्वेद विद्याशाखा व सिनेट सदस्य, शैक्षणिक सदस्य, अध्यक्ष अभ्यास मंडळ अमरावती विद्यापीठ अमरावती, सिनेट सदस्य महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नाशिक, अकॅडमिक काउन्सिल सदस्य महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नाशिक, अध्यक्ष महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिन MCIM मुंबई, सदस्य महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिन MCIM मुंबई सदस्य, प्रथम अध्ययन मंडळ महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नाशिक व इतर अनेक पदे भूषवलेली आहेत. आयुर्वेदाच्या प्रचार आणि प्रगतीसाठी प्रदान केलेल्या आपल्यासह निष्ठा, निस्वार्थ शैक्षणिक योगदान आणि गतिमान नेतृत्वासाठी सरकारी प्रशासन आणि विविध विद्यापीठामधील विविध प्राधिकरणांनी आणि संस्थांनी आपल्याला नामांकित केले होते. आपण महाराष्ट्र शिक्षक महासंघाचे अध्यक्ष व सचिव आणि विदर्भ आयुर्वेद शिक्षक संघाचे अध्यक्ष होता. आयुर्वेद क्षेत्रात आपण केलेल्या कामाची अमूल्य सेवेबद्दल आणि ते अजूनही करत असलेल्या अविरत सेवेबद्दल आयुर्वेद विश्व आपले ऋणी आहे. धन्यवाद सर.
Thank you, sir. Thank you all the dignitaries. Vidya Vitarka Vijnanam Smriti Tatparata Kriya. That's said by Acharya Charan. All these qualities in a one person, in a one dynamic personality. So the next Global Ayurveda Ambassador Award, a special person within us on the dais, who is the youngest personality in the field of Ayurveda, I'll say, especially Dr. Subhash Ranade sir and Honorable Dr. Sunanda Ranade madam. So I request all the dignitaries for this award. Sir has a great role in spreading Ayurveda globally. It's really an inspiring journey. If you heard, Sir's inspirational journey for the spread of Ayurveda all over the world. Congratulations, sir. Congratulations, madam. He is so lucky for having such a great Ardhangini who is also having the same qualities like Dakshatirthartha Shastrati Drishta Karma Shuchihi, which are required for a best Vaidya. She is a best Vaidya, I'll say. She is also the youngest Vaidya in the field of Ayurveda who is contributing the same superb dedication towards Ayurveda for spreading Ayurveda knowledge and Ayurveda inculcating the Ayurvedic habits in persons. She starts with her own for inculcating Ayurvedic habits, Ayurveda lifestyle with her own. Congratulations, sir. Congratulations, ma'am. Thank you all the dignitaries. Please have seat. Technical team, please help. Ekam Shastra Madhyano, न जानियात शास्त्र विज्ञानिया. So Sushruत, according to Acharya Sushruत, the person, the Vaidya who want to become a best Vaidya should have a Bahushrutata, means having knowledge of multiple fields, multidisciplinary approach, which we have heard by respected Vice Chancellor Madam. So we have such a person with us. Now I request the eminent personality in the field of Ayurveda and biomedicine, Dr. Suresh Patankar sir, the chief guest of this program, for his valuable guidance. Dr. Suresh Patankar sir, please.
व्यासपीठावरले मान्यवर आजगावकर साहेब, माझे मित्र सावरीकर सर ज्यांचा जीवन गौरव झाला, ज्यांनी मला आयुर्वेद शिकवलं ते सुभाष रानडे मॅडम रानडे, युनिव्हर्सिटीचे पूर्व व्हाईस चान्सलर प्रोफेसर निकुम आणि यंग टीम सूर्यवंशी चौधरी सर आणि आपण सर्व मान्यवर. मला इथे बोलून आपल्याला सावरीकर सरांचा सत्कारची संधी दिली त्यावेळी मी आपला आभारी आहे, खरोखरच आभारी आहे की अचिव्हमेंट ज्याला आपण म्हणतो, म्हणजे काय ते सावरकर सरांनी दाखवून दिलेलं आहे. सर पुन्हा एकदा तुमचं अभिनंदन. मला तर 2 का 3 वर्षापूर्वी मी या कॉन्फरन्सला आलो होतो आणि तेव्हा माझी एक तक्रार होती. तक्रार अशी होती की आयुर्वेद 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 आपण खूप आयुर्वेदाबद्दल बोलतो, सांगतो, ऐकतो, वाचतो, परंतु आयुर्वेद जर ग्लोबलाइज करायचं असेल, जे आपलं शास्त्र आहे आणि ते शास्त्र आहेत गेले 3000 वर्षापासून किंवा अधिक काळापासून ते अस्तित्वात आहे, ते शास्त्र आहेच, मग ते पुन्हा सिद्ध करायची गरज आहे का? जे आजच्या कॉन्फरन्सची थीम आहे एव्हिडन्स बेस. लोकांना प्रश्न पडतो, हो म्हणजे मला बरेच आयुर्वेदिक डॉक्टर म्हणतात की वात पित्त कफ आहेच ना. हो आहे ना, बरोबर आहे, नाही म्हणतच नाही. परंतु कालानुरूप जे बदल घडत राहतात त्या बदलांना आपण सामोरं गेलो नाही तर आपण टिकू शकत नाही. आणि हीच परिस्थिती आज आयुर्वेदाची झालेली आहे. आणि खरोखर पण काळ बदलतोय आणि आता काळ अनुकूल आला असं मी म्हणेन. की करोनाच्या काळामध्ये ट्रॅडिशनल सिस्टीम्स ऑफ मेडिसिन म्हणजे पारंपरिक औषधं जी वापरली जातात त्याचं महत्व अधोरेखित केलं गेलेलं आहे. त्याचबरोबर सरकार म्हणजे ज्याला आपण राजमान्यता म्हणतो, जर राजाश्रय ज्याला आपण म्हणतो, तोही मिळत चाललेला आहे. आता कमी कशाची आहे? कमी आहे, नक्कीच आहे. कमी आहे ती थोडस मी कठीण बोलेन की आयुर्वेदामध्ये जे लोक व्यवसाय करतात, प्रॅक्टिस करतात, शिक्षण देतात, कमी त्यांच्यामध्ये आहे. आयुर्वेद टीचर्स ज्याला आपण म्हणतो की टीचर हू टीचर्स, जो शिकवतो, त्यामध्ये आमूलाग्र बदल करण्याची गरज आहे. मी बऱ्याच ठिकाणी सिलेक्शन कमिटी असेल, इंटरव्ह्यूज असेल, निर्णय पोस्ट त्या ठिकाणी जातो. तर जेव्हा जेव्हा मी रिसर्च, कारण असं आहे की रिसर्च ही एकच गोष्ट जी तुम्हाला म्हणजे रिसर्च फक्त आयुर्वेदामध्ये नाही, मेडिसिनमध्ये नाही, कुठल्याही क्षेत्रात असा रिसर्च ही एकच गोष्ट ज्याला आपण अनुसंधान म्हणतो, जे आता मोदीजींनी सांगितले, जे अनुसंधान हे त्यांनी जोडलेले, जय जवान जय किसान, शेवटी जय अनुसंधान, ही एकच गोष्ट राष्ट्राला पुढे नेणारी आहे. आणि त्यामध्ये औषधी शास्त्रामध्ये आपला वाटा खूप मोठा आहे आणि त्याच्याही मध्ये आयुर्वेदाचा वाटा खूपच मोठा आहे. आपण जेव्हा जेव्हा मॉडर्न मेडिसिन ज्याला आपण म्हणतो, आधुनिक वैद्यक शास्त्र, हे आपलं नाहीये, आपलं नाहीये, पण तरीही आज ते जगभर मान्यता पावलेलं आहे. तसंच आयुर्वेद शास्त्र जर आपल्याला जगाने मान्य करायचं असेल, मी म्हणून, सावरीकर सरांनी म्हणून, राणे सरांनी म्हणून आयुर्वेद मोठा होत नाही. तर त्यासाठी तुम्हाला काहीतरी एव्हिडन्स द्यावा लागेल, ज्याला मी म्हणतो कॉन्टेम्पररी आयुर्वेद. आपल्याकडे अशी कल्पना आहे की जे आपले ग्रंथ लिहिले गेलेले आहेत ते म्हणजे काय म्हणतो अपौरुषीय असं थोडंसं त्याला हे केलं गेलेलं आहे. तसं नाहीये. त्याही व्यक्ती होत्या, त्याही शास्त्रज्ञ होते, त्यांनी त्या काळानुरूप त्यांनी जे काही सिद्धांत मांडले, जे आजही बरोबर आहे, पण त्याकडे पुन्हा ज्याला म्हणतो रिलुक, रिव्हिजिट करण्याची गरज आहे. तर हे शास्त्र आपलं पुढे जाऊ शकेल. तर ज्याला आपण एव्हिडन्स म्हणतो, एव्हिडन्स म्हणजे काय की आत्ताची जी प्रचलित शास्त्रीय पद्धती आहे ती पद्धती खूप म्हणजे बरेच लोक म्हणतात की नाही मॉडर्न मध्ये पण ती जे काही सिस्टीम आहे ती चुकीची असेल, पण अजूनही आपल्याकडे आयुर्वेदामध्ये पर्यायी संशोधन पद्धती जोपर्यंत येत नाही, जी आपण एस्टॅब्लिश करतो, जी आपण करायला पाहिजे होती, की ज्याला जागतिक मान्यता मिळेल, तोपर्यंत तरी जे ग्लोबल पॅरामीटर्स आहेत ह्या पॅरामीटर्स नुसारच आपल्याला संशोधन केलं गेलं पाहिजे. दुसरा मुद्दा असा आहे की एक इंग्लिशमध्ये प्रॉवर्ब आहे, व्हेन यू गो टू रोम डू एज व्हॉट रोमन्स डू. आज सगळं जग आपल्याकडे पाहते, पण अशा वेळेला तुमचा जो आयुर्वेद आहे हा जागतिक परिभाषेत सांगितला गेला पाहिजे. त्यातलं बरंचसं काम रांडे सर करत आहेत, पण खूप करण्याची गरज आहे. की आपले जे सिद्धांत आहेत, आपण नेहमी म्हणतो की आम्ही कसं दाखवू शकतो, वात कसं दाखवू शकत नाही, पित्त कसं दाखवू शकत नाही. तर मी स्वतः अभ्यास केला माझा स्वतःचा, म्हणजे माझी बॅकग्राऊंड ही आयुर्वेदामधलीच आहे. त्यानंतर मी MBBS केलं, MS केलं, MCH केलं, FRCS केलं. आणि जेव्हा माझा संपूर्ण साकल्याने, आता मी योगाचा पण अभ्यास करतो, योगाचा मी विद्यार्थी आहे, तेव्हा माझ्या लक्षात आलं की सर्व सायन्सेस आर फंडामेंटल्स आर सेम. ती फंडामेंटल्स कुठल्याच बदलू शकत नाहीत. मग आयुर्वेद असो, ॲलोपॅथी असो, कुठलं तुम्ही अगदी चायनीज मेडिसिन घ्या, फंडामेंटल्स रिमेन द सेम. फक्त तुम्हाला त्यातलं मिनिंगफुल अंडरस्टँडिंग त्यातलं शोधून काढलं पाहिजे आणि ते तुम्हाला एक्सप्रेस केलं गेलं पाहिजे. साधी मी तुम्ही कल्पना, अग्निकल्पना ज्याला आपण म्हणतो की अग्निचिकित्सा आयुर्वेदामध्ये सर्वात महत्वाची मानली जाते. मी तर उलट असं म्हणेन की जर तुम्ही अग्नीवर चिकित्सा केली, भूताग्नी ज्याला आपण GI सिस्टीम म्हणू, लिव्हर म्हणू आणि सेल्युलर मेटाबॉलिझम म्हणू, जे मायटोकॉन्ड्रिया करतात, ही जर कल्पना मी विचार केला, त्याच्यावर एक माझं कॉन्टेम्पररी मिनिंग इन मॉडर्न मेडिसिन ऑफ अग्नी कन्सेप्ट मला लक्षात आलं की बऱ्याचशा गोष्टी सिमिलर आहेत. अगदी पाचक पित्त असेल, ॲलोपॅथीमध्ये पण त्याला काहीतरी आहे ना, त्याचा आपण अभ्यास केला पाहिजे. त्याला मी म्हणतो इंटिग्रेटिव्ह रिसर्च. आता जे रिसर्च केलं जातं म्हणजे आयुर्वेदिक, ज्याला आपण मी म्हणेन की PhDचे मी थिसिस पाहतो किंवा आयुर्वेदिक रिसर्च पाहतो, दॅट इज प्युअरली आयुर्वेदिक कन्सेप्ट. त्याच्यामध्ये बरेच फ्लॉ राहतात. अजून ती सिस्टीम आपण ती प्रगल्भ केली नाहीये, ज्याला आपण म्हणून शास्त्रीय संशोधन पद्धती अजून झालेली नाहीये. मग तो पण तुम्ही काय करू शकता की तुमचं जर ज्ञान, तुमची माहिती ही जर दुसऱ्याला द्यायची असेल ती तुम्ही त्यांच्या भाषेत सांगितली गेली पाहिजे. आणि ही खूप महत्वाची गोष्ट आहे. यावर खूप टीका केली जाते की नाही, आमच्या आयुर्वेदामध्ये कन्सेप्ट कोणाला आम्ही सांगू शकत नाही, दाखवू शकत नाही. एक 10 वर्षापूर्वी हे खरंही असेल की वात म्हणजे काय, पित्त म्हणजे काय, पण जसं जसं आपण ज्याला म्हणतो बायोकेमिस्ट्री, नॅनो टेक्नॉलॉजी जसं जसं दिसायला लागेल, आता आपण म्हणून भस्म ही कल्पना शास्त्रामध्ये. आता नॅनो टेक्नॉलॉजी सिमिलर टू दॅट, काही फरक नाहीये. जर नॅनो मॉलिक्युल्स की ज्याच्यामध्ये आपण म्हणतो की रसशास्त्राची औषधं वापरल्यानंतर इमिजिएट इफेक्ट दिसतो. तो कशामुळे दिसतो? इट इज द नॅनो साईज इतका 10 to 20 साईज मॉलिक्युल जर तुम्ही तयार केला, कंपाऊंड तयार केलं, इट विल पेनेट्रेट द सेल इझिली, सो यू विल गेट द इफेक्ट. त्याचबरोबर आणखीन एक गोष्ट ही या ठिकाणी सांगणं महत्वाचं आहे की जेव्हा आपण आयुर्वेद सांगतो, आपण नेहमी सांगतो की काही प्रॉब्लेम नाही, सगळं बरं होणार आहे, नो साईड इफेक्ट्स. इफ दर नो साईड इफेक्ट, दर नो इफेक्ट्स ऑल्सो. हे आपण ठासून सांगायला पाहिजे. आता ॲलोपॅथीमध्ये येतात ना की दिस ड्रग कॅन गिव्ह सिव्हिअर अॅनाफिलॅक्टिक रिॲक्शन, किमोथेरपी आपण सांगतो उदाहरण घेऊ, ते सांगतात बोन मॅरो डिप्रेशन होईल, पेशंट मे डाय ऑफ द ट्रीटमेंट. दे आर व्हेरी ओपन अबाउट इट की आमच्या औषधाला साईड इफेक्ट भरपूर आहेत. ही पण आपली समाजातली कल्पना काढून टाकली पाहिजे. जेव्हा आपल्याकडे पेशंट, माझ्याकडे आता किडनी स्टोनचे पेशंट येतात, गंमत अशी आहे की तो स्टोन 3 सेंटीमीटरचा असला तरी मी त्याला औषध देऊन तो पाडतो, असं जेव्हा वैद्य म्हणतो तेव्हा त्याची चेष्टा होते. आयुर्वेदाने सांगितलं नाहीये की प्रत्येक तुम्ही स्टोन विरघळू शकता. तुमचे लिमिटेशन्स काय हे तुम्ही समजून त्यापर्यंत तुम्ही प्रॅक्टिस केली, इफ यू प्रॅक्टिस ऑनेस्टली की माझे लिमिटेशन्स आहेत, हे मी करू शकत नाही, आयुर्वेदामध्ये सांगता हो माझ्याकडे काय नाही बाबा, आता तू कुठेही जा, करून घे, प्रयत्न कर. तसं आयुर्वेदिक संशोधनामध्ये पण हा प्रामाणिकपणा पाहिजे. हा जर प्रामाणिकपणा नसेल तर मग ते संशोधन हे काळाच्या ओघात वाहून जाईल, त्याला मान्यता मिळणार नाही. संशोधन करताना म्हणजे ॲलोपॅथीमध्ये मी असं म्हणतो की 100% संशोधन प्रामाणिक असतं, त्याच्यामध्ये अप्रामाणिकता आहे, पण प्रामाणिकपणा पण आहे म्हणून ते शास्त्र टिकलेले. आणि जे प्रत्येक वेळा सांगतात हो आम्ही आज ही थेरी मांडली, ही थेरी बरोबर नव्हती, आम्ही त्याच्या नवीन थेरी मांडत आहोत, हे फ्लॉज आहेत. तसं आपल्याला आयुर्वेदामधले जे सिद्धांत आहे त्याच्यावर आयुर्वेद, मी असं म्हणत नाही की तुम्ही आयुर्वेदिक कन्सेप्ट सोडून द्या, ती 100% बरोबर. माझ्या हॉस्पिटलमध्ये आम्ही होलिस्टिक ट्रीटमेंट देतो. म्हणजे आम्ही काय करतो की आम्ही ठरवतो की हो ह्याला ॲलोपॅथीला स्टोन झालेला आहे, ऑपरेशन करायला पाहिजे, बरोबर. पण ज्याला आपण किडनी रिज्युनेशन आहे, त्यासाठी ज्याला आपण म्हणतो की आपल्यामध्ये मूत्र काम करणारे एक औषध आहे, पुनर्नावासारखं चांगलं औषध आहे, ही देऊन तुम्ही इंटिग्रेटिव्ह ट्रीटमेंट देऊ शकता की जे पेशंटलाही बरं वाटतं की हो डॉक्टरने मला सांगितले खडा काढायला पाहिजे, बरोबर आहे, पण डॉक्टर मला हेही सांगितले की आयुर्वेदानुसार मी आहार केला, औषधं घेतली तर माझ्या किडनीवरती चांगला इफेक्ट होऊ शकतो. CKD आहे, क्रॉनिक किडनी डिसीज आहे, की ज्याच्यामध्ये देर इज नो ट्रीटमेंट इन ॲलोपॅथी, फक्त सिम्पटमॅटिक ट्रीटमेंट. ते सांगतात हो आमच्याकडे काही नाही, नाहीतर आम्ही तुम्हाला डायलिसिस करून ते ट्रान्सप्लांट करू. पण जर यावर तुम्ही इंटिग्रेटिव्ह ट्रीटमेंट दिली तर डेफिनेटली मी स्वतः माझा स्वानुभव तुम्हाला सांगतो की रुग्णाला बरं वाटतं. आणि शेवटी रुग्णाला बरं वाटणं हा क्रायटेरिया जास्त महत्वाचा आहे. तर रिसर्च करताना इंटिग्रेटिव्ह जर अप्रोच असेल आपला की ज्यामध्ये आयुर्वेदिक तुम्ही सोडायचं नाही, आयुर्वेदिक कन्सेप्ट तुम्ही करा आणि पॅरलली तुम्ही त्याचं मॉडर्न मधलं काय नॉमेनक्लेचर असेल, पॅरामीटर ते तुम्ही लावून हे करा आणि त्याप्रमाणे तुम्ही हे करा. दुसरी गोष्ट, जेव्हा आपण आयुर्वेदाची चिकित्सा करतो तेव्हा आपल्याकडे जे काय सांगितलेले निरीक्षण सांगितले, नाडी, त्याच्यानंतर पंचेंद्रिय परीक्षण वगैरे, हे त्या काळी होतं. पण आज सायन्स एवढं पुढे गेलंय, शास्त्र एवढं पुढे गेलेलं आहे की बायोकेमिस्ट्रीमध्ये, फिजिक्समध्ये ही साधनं आलेली आहे. जसं आपण सांगायचो की बाबा डोळे पिवळेने तुला काळविळी झालेली किंवा युरिन मध्ये फेस आला म्हणजे प्रोटीन झाले, असं आपण म्हणतो. आता तुम्हाला प्रोटीन टेस्ट करता येते, तुम्ही इंटिग्रेशन करणं महत्वाचं आहे. ही जी काही नवीन शास्त्र उपलब्ध आहे ही काही मॉडर्न मेडिसिनची मक्तेदारी नाही, 100% नाही. हे सायन्स वेगळंच, हे फिजिकल सायन्सेस आहेत ज्याचा उपयोग करून मॉडर्न मेडिसिन हे पुढे जात चालेल. त्याच्याच बरोबर जेव्हा मी आयुर्वेदाकडे तुम्ही पेशंट येतो, तुम्ही इनिशिएट करून घ्या ना. काय रे, का हरकत काय आहे तुम्हाला? तुम्हाला असं वाटतं याला काविळी झाली, ते लिव्हर फंक्शन टेस्ट करा, ट्रीटमेंट द्या आणि पहा खरोखर फरक पडतो का. आणि हा जर एव्हिडन्स तुम्ही जपून ठेवला आणि दाखवला तर त्याला कोणी नाही म्हणणार नाही. प्रॉब्लेम असा येतो की नको म्हणजे तू काय करू नकोस, तुला बरं वाटतंय ना, राहू दे ना, म्हणजे तुमचा स्वतःवर विश्वास नाही का, अशी एक माझ्या मनात शंका येते. असं पण असू शकेल की हो मी तुला खडा झाला ना, आमच्याकडे कसं मॉडर्न मध्ये खडा काढले की एक्सरे कर, सोनोग्राफी कर, हे कर ते कर आणि कन्फर्म कर. तसं आपल्याला करेक्टिव्ह ट्रीटमेंट दिल्यानंतर करेक्शन झाली की नाही तसं पेशंट सांगतो, तसंच इन्व्हेस्टिगेशन करून देखील तुम्ही ते दाखवणं, हा एव्हिडन्स ज्याला आपण, दॅट इज एव्हिडन्स. व्हॉट इज एव्हिडन्स बेस? हा जर आपण एव्हिडन्स प्रत्येक आयुर्वेदिक वैद्याने जर केला, प्रॅक्टिसमध्ये केला, टीचरांनी जर ते मेथडॉलॉजी ठरवली, ह्याच्यावर खूप काम करण्यासारखे की आयुर्वेदिक वे ऑफ रिसर्च त्याच्या मॉडेल तयार करू शकतो. मी सावरीकर सरांसारखे काही लोक आहेत ते तुम्हाला मदत करू शकतात की आयुर्वेदाची ही पद्धती रिसर्चची, हे आपले पॅरामीटर्स आहेत आणि या पद्धतीने आपण रिसर्च करू. दुर्दैवाने आज आयुष हे वेगळं मंत्रालय झालंय, तिथे काही मला झालेलं दिसत नाही. मी स्पष्ट सांगतो, जर आयुर्वेद पुढे न्यायचं असेल तर आयुर्वेदिक जे विद्यार्थी आहेत तेच पुढे नेऊ शकतील. नाही तर आज मी पाहतो तुम्हाला सांगता योगाचा मी अभ्यास करतो, तर आमच्या हॉस्पिटल असं ठरलं की आपण योगा करतो, योगा देऊन काही फरक होऊ शकतो का पेशंटच्या याच्यामध्ये, बिकॉज योगा ऍक्ट ऑन द माइंड. मग ठरवलं की पेरी ऑपरेटिव्ह रोल ऑफ योगा असं आपण काहीतरी करूयात, वेगळं काहीतरी आम्हाला नेहमी आमच्या डोक्यात असतं. तर म्हटलं आपण थोडंसं लिटरेचर पाहूया. मला आश्चर्य वाटलं, इरास अर्ली रिकव्हरी आफ्टर सर्जरी, मग त्यांनी पॅरामीटर्स मध्ये त्यांनी माइंडफुल अटेन्शन म्हणजे मेडिटेशन त्यांनी सांगितलेलं. म्हणजे ऑलरेडी पाश्चात्य देशामध्ये याचा अभ्यास करून मेडिटेशन त्यांनी सांगितलेलं आहे, त्यांनी साऊंड थेरपी सांगितलेली आहे आणि ह्याच्यावर काम करून त्यांनी प्रूव्ह केलेले, देयर आर पेपर्स की खरोखरच योगाचा उपयोग केला. कारण पेशंट स्ट्रेस आउट असतो, त्याचा म्हणजे आपण साध्या भाषेत म्हणतो ॲड्रेनालिन सिम्पॅथेटिक सिस्टीम स्टिम्युलेट झालेली असते, कॅटेकॉलॉग म्हणजे स्टिम्युलेट झालेले असतात. त्याच्यामुळे बॉडीचा ज्याला आपण म्हणतो कॅटॅबॉलिझम होतो, ताकद कमी होते, शक्ती कमी होते. तर जर आपण जसं आपण शारीरिक ट्रीटमेंट देतोय, अँटीबायोटिक देतोय, काय बाकी तुमची मेडिसिन्स देतोय, तर त्याच्याबरोबर तुम्ही योगाचा, कारण सर्जरी ह्या विषयामध्ये जसं आपण आयुर्वेदामध्ये शरीर आणि मनाचा विचार केला जातो, मॉडर्न मध्ये आम्ही फक्त बॉडीचा विचार करत होतो. आता आम्हालाही कळायला लागले की नाही, बरोबर, माइंड इज इक्वली इम्पॉर्टंट ऑर मोर इम्पॉर्टंट ॲट टाइम्स. शस्त्रक्रिया जेव्हा पेशंट येतो तो इतका स्ट्रेस आउट असतो, मग त्याच्यामुळे तिने सांगितले की ब्लड लॉस होणं, अॅनेस्थेशियाची म्हणजे रिक्वायरमेंट ऑफ ड्रग्स ज्याला आपण म्हणू स्लीपिंग मेडिसिन त्याची रिक्वायरमेंट आहे, अर्ली मोबिलायझेशन आहे. ह्याच्यावर त्यांनी अभ्यास करून त्यांनी पेपर दाखवलेले, हे जर तुम्ही केलं तर डेफिनेटली पेशंटला त्याचा फायदा होतो. हीच जर गोष्ट आज आपण केली नाही तर काही दिवसांनी तुम्हाला माइंडफुल ब्रीथिंग म्हणजे आपलंच मेडिटेशन हे आपल्याला ते शिकवून सांगतील की ह्या पद्धतीने केलं तर, आणि आम्ही ते फॉलो करतो. तेव्हा मला असं वाटतं की फारसे मी आता बोलत नाही, आज इथे सगळे टीचर्स आहेत आणि त्यांची जबाबदारी असं मी समजतो की बी ऑनेस्ट टू युअर सायन्स. तुम्ही तुमच्या शास्त्राशी प्रामाणिक राहिलं पाहिजे, तुमचा स्वतःवरती आणि तुमच्या शास्त्रावरती आत्मविश्वास पाहिजे. हो, सावरीकर सर नेहमी म्हणतात की अरे एवढे आयुर्वेदिक, आता म्हणजे राहुलने सांगितले की कॉलेजेस उघडा. कॉलेज उघडून तुम्ही काय करणार? फक्त ग्रॅज्युएट तयार करणार? ते काय करतात पुढे? आर दे कॉन्फिडंट इन द प्रॅक्टिस? नाही, फॅक्ट आहे, म्हणजे आपण मान्य करूयात. आपण जर मान्यच नाही केलं तर आपण काहीच करू शकत नाही. म्हणजे पण त्यांना तुम्ही तुमच्या असं ॲलोपॅथीचा माणूस म्हणतो का मला आयुर्वेद करायचं आहे, तो नाही म्हणत का, तो त्याला खात्री आहे की नाही मी जे काही शिक्षण घेतो त्याच्यावर मी जगू शकतो, माझी उपजीविका करू शकतो. कारण आपलं क्वालिटी ऑफ एज्युकेशन इतकं खराब झालेलं आहे दुर्दैवाने की कॉलेजेस काढण्याच्या नादात, आयुर्वेदिक ग्रॅज्युएट्स काढण्याच्या नादात आपण त्या शास्त्राचं डिव्हॅल्युएशन केलेलं आहे. म्हणजे जे मी शिकलो, बाबू नानल होते पण माहितीच आहे, ते शिकलो अजून विसरलं नाही. आणि मला लक्षात आलं की मी भाग्यवान आहे की मला आयुर्वेदाचा पण अभ्यास करायची संधी मिळाली आणि मॉडर्नचा पण अभ्यास करायची संधी मिळाली. आणि आता मी योगा करतोय, मी स्टुडंट आहे. मी असं म्हणत नाही मी खूप शिकलेला माणूस आहे. तुम्ही ऍज अ स्टुडंट म्हणून तुम्ही राहिला. टीचर शुड ऑलवेज रिमेन अ स्टुडंट. टीचर नेव्हर थिंक आय एम ए टीचर. संपला आता माझं टीचर, मी पीजी टीचर झालो म्हणजे आता मला काही करण्याची गरज नाही अशी एक आपल्याकडे धारणा होते. मी प्रोफेसर झालो म्हणजे मी सगळं जगत मान्य झालं. तसं नाही. यू आर स्टील अ स्टुडंट. यू लर्न अँड गिव्ह दॅट नॉलेज टू युअर स्टुडंट्स. तर त्याच्याही मध्ये मला असं वाटतं की थोडंसं मी कॉलेजेस, माझा उद्देश असा नाही की आयुर्वेद तुम्ही हे करू नका, पण तुमचे जे ग्रॅज्युएट्स बाहेर पडतील ते सेल्फ सफिशियंट होतील, त्यांना ज्ञान मिळेल, गुणवत्ता मिळेल आणि त्यांना आत्मविश्वास वाटेल. आणि आता खरोखरच मी आता काही जेव्हा फिरत असतो तर काही आयुर्वेदिक तरुण मुलं खरोखर आयुर्वेदामधून प्रॅक्टिस करतात. त्यांना विचारतो, माझ्याकडे बरेच येतात, पेशंट म्हणून येतात, भेटायला येतात, हो सर मला आयुर्वेदामध्ये करायचं आहे. म्हणजे स्टिक टू युअर सायन्स. पण आयुर्वेद हा प्रॅक्टिस करायला जास्ती अवघड आहे. ॲलोपॅथी खूप सोपी आहे. आम्ही तर आमचे जे मेडिकल रिप्रेझेंटेटिव्ह हल्ली आम्हाला शिकवतात, सर हे मेडिसिन दे दो ये हो जाएगा, फिर सीखने की जरूरत नहीं हमको. तसं आयुर्वेद होऊ शकत नाही. फॅक्ट आहे. तर गुणवत्तापूर्वक शिक्षण देणं. जे पीएचडीचे स्टुडंट असतात, खरोखर पीएचडी म्हणजे फार मोठी डिग्री आहे. तुम्हाला सांगतो मित्रांनो, जेव्हा मी म्हणतो मी पीएचडी झालोय तेव्हा माझ्या मनालाही पटलं पाहिजे. लोक मला म्हणतात पीएचडी झालाय म्हणजे मोठा नाही. पीएचडी ही मी असं म्हणेन की संशोधनामधली अत्युच्च पदवी आहे. तर त्याला जे संशोधन केलं गेलं पाहिजे. तसं काय पीएचडी होणारे खूप होतात. खूप म्हणजे आता मी एमबीबीएस मध्ये काम करतो, तुम्हाला सांगायला हरकत नाही. पुन्हा मी आयुर्वेदामधूनच बोलणार आहे, थोडंसं कडक बोलणार. भरपूर आयुर्वेदिक पीएचडी पोत्याने असं म्हणायचा एक शब्द वापरला जातो. आता एवढे जर पीएचडी व्हायला लागले तर मग काय पुढं काम का आयुर्वेदाला काय हे दिसत नाही. एवढे जर पीएचडी होत आहे तर कुठं संशोधन का कुठं दिसत नाही आपल्याला. का मी असं म्हणतो आम्हाला एव्हिडन्स बेसची गरज आहे? काहीच गरज नाही ना. म्हणजे मला वाटतं 10 times more than modern medicine PhDs are there in Ayurveda to some extent homeopathy. सायन्स मध्ये कुठेच काही दिसत नाही. पीएचडी हा संशोधनाचा विषय. एवढं जर संशोधन होत असेल तर खरोखर आयुर्वेद पुढे गेला पाहिजे. त्यावरही म्हणजे निकुंभ सर मला वाटतं युनिव्हर्सिटीमध्ये ह्याचे आहे, तिथेही थोडस संशोधनावरती काही क्रायटेरिया जे आपण म्हणू हे अधिक कडकपणे वापरले गेले पाहिजेत. पुन्हा मी सांगेन की एव्हिडन्स म्हणजे काय. एव्हिडन्स नाही म्हणजे आय एम नॉट अगेन. आयुर्वेद सायन्सही आहे, सायन्स राहणारच आहे. ही आपली जबाबदारी की त्याच्यामधल्या ज्या गोष्टी आहेत त्या आजच्या भाषेमध्ये आपल्याला सांगायला पाहिजे. ज्याला मी असं म्हणतो कॉन्टेम्पररी आयुर्वेद. धन्यवाद.
थँक्यू सर.
क्षमा करा, थोडंसं सर्जरीला जायचंय, थोडं उशीर झाला, पण आपण भेटूया. धन्यवाद.
Now moving forward for the award declaration, other award declaration. In Marathi, we call it as a Kautuk Sohora. So now I'll request Dr. Revan Siddha Usturge sir, HOD and Associate Professor from Department of Agartantra, SGR Ayurved Mahavidyalay, Solapur, for the further awards and award ceremony. So,
thank you, ma'am. Now we will move to the most awaited part of this event, that is the award ceremony. I will declare one by one these awards. First one, Best National Ayurveda Administrated Award goes to Dr. Nitin Kaveri sir, MHS Nashik. Sir is absent today due to his personal problem. Next is Best National Ayurveda Practitioner Award goes to Dr. Sohan Pathak sir. I request respected Asrawkar sir to hand over the award. Dr. Sohan Pathak. Next award, Best Teacher National Award in Sanhita Siddhanta for UG, Dr. Jaya Nitin Jane. Dr. Jaya Jane, madam, please come on the stage. I request honorable dignitaries to hand over the award.
Dr. Jaya Nitin Jane Madam. UG Best Teacher National Award is Sangeeta Siddharth. Next award, Best Teacher National Award is Sangeeta Siddharth. PG Dr. Yogita Jamdade Madam. Dr. Yogita Jamdade Madam for Best Teacher National Award in Sangeeta Siddharth. Next award, Best Teacher National Award in Rachna Sharif UG Dr. Vaishali Kurve Madam. Dr. Vaishali Kurve, Best Teacher National Award in Rachna Sharif UG. I request all the dignitaries on the dais to hand over the award. Next award, Best Teacher National Award in Shari Rachna, Dr. Bandapalle Gattu. Best Teacher PG. Best Teacher National Award in Kriya UG, Dr. Sharyu Phule Madam. Dr. Sharyu Phule. For PG in Kriya Shari, Dr. Meenakshi Randive Madam. For PG in Sharir Kriya. For UG, Dr. Sharyu Phule in Kriya Sharir. For PG in Kriya Sharir, Dr. Meenakshi Randive. Next award, Best Teacher National Award in Dravya Gun, U for UG, Dr. Vinod Patange sir from Satara. Dr. Vinod Patange sir. Next award, Best National Teacher Award in Dravya Gun PG, Dr. S. Pawan Kumar. Dr. S. Pawan Kumar. For UG, Dr. Vinod Patange sir. For PG in Dravya Gun, Dr. S. Pawan Kumar. Dr. S. Pawan Kumar. Next award, Best Teacher National Award in Rog Nidan. For UG, Dr. Sital Chavan Madam. For UG, Rog Nidan, Dr. Sital Chavan Madam. For PG in Rog Nidan, Dr. Arun Wankhede sir. Dr. Arun Wankhede. In Dravya Gun for UG, Dr. Sital Chavan. For PG, Dr. Arun Wankhede sir. Best Teacher National Award in Rasa Shastra, Vice Principal of State Govindji Raoji Ayurveda Mahavidyalaya, Dr. Shantinath Bagewadi sir. Next teacher, Best Teacher National Award in Rasa Shastra for UG, Dr. Shantinath Bagewadi. He is also a Vice Principal of HJR Ayurveda College Solapur. Best Teacher National Award in PG, Dr. Bharat Rathi sir. Dr. Bharat Rathi. Please come on the stage. Best National Award Rasa Shastra PG, Dr. Bharat Rathi. Best Teacher in National Award in Agat Tantra UG, Dr. Sandeep Binorkar. Due to some personal reason, he is absent today. On behalf of Dr. Binorkar sir, I request Dr. Ashwin Bagde sir to collect his award. Dr. Ashwin Bagde to collect the award of UG Agat Tantra for Dr. Sandeep Binorkar. Best Teacher National Award in Agat Tantra PG, Dr. Vidya Undale Madam, Hadapsar College. PG Agat Tantra, Dr. Vidya Undale. Best Teacher National Award in Sasturta UG, Dr. Mrudul Chitarkar Lonkar. Best Teacher National Award in Sasturta. Please come on stage, madam. Best Teacher National Award in Sanskrit PG, Dr. P. Sudhakar Reddy. Dr. P. Sudhakar Reddy. UG Sanskrit, Dr. Mrudul Lonkar Madam. PG Sanskrit, Dr. P. Sudhakar Reddy. Next award, Best Teacher National Award in Prasuti Tantra for UG, Dr. Swati Mohite Madam. Dr. Swati Mohite Madam. Best Teacher National Award in Sri Row, UG. For PG, for Prasuti Tantra, Dr. Suhas Herelekar sir. Dr. Suhas. Dr. Suhas. Next Best Teacher National Award is Kumar Bhruti Tantra for UG, Dr. Nilesh Ingle sir. Dr. Nilesh Ingle. Kumar Bhruti UG. For Kumar Bhruti PG, Dr. Kishore Patarne. Kumar Bhruti PG. Dr. Kishore, please come on the stage. Best National Teacher Award in Kai Chikitsa for UG, Dr. Sood, Kathy Sushant. Best Teacher National Award, Kai Chikitsa UG, Dr. Sood Khati. Best Teacher National Award in PG Kai Chikitsa, Dr. Rajan Kulkarni sir. Dr. Rajan Kulkarni sir, please come on the stage. Best National Award in Shalya Tantra UG, Dr. Rahul Baviskar. Dr. Rahul Baviskar, please come on the stage. Best Teacher National Award in Kai Chikitsa PG, Dr. Rajan Kulkarni sir. Best Teacher National Award in Shalya Tantra UG, Dr. Rahul Baviskar sir. Best Teacher National Award in Shalya Tantra PG, Dr. Gadve. Dr. Gadve GN. Right, please. Best Teacher National Award Shalya Tantra UG, Dr. Rahul Baviskar. Best Teacher National Award in Shalya Tantra PG, Dr. Gadve sir from CSMSS, Ayurveda College, Aurangabad. Best Teacher National Award in Panchakarma for UG, Dr. Savarkar Poonam. I request Dr. Anant Dharmadhikari sir to come on the stage. Dr. Anant Dharmadhikar, ADI sir, please come on the stage to hand over the award. Sorry sir, Dr. ADA Dr. Dharmadhikari sir, please come on the stage. So, Dr. Poonam Savarkar, Dr. Manjusha Sunil More from Best Teacher National Award in Panchakarma. Best Teacher National Award Panchakarma, Dr. Manjusha More. Best Teacher National Award in Shalakya Tantra for UG, Dr. Milind Gore sir from Ayurveda College, Mumbai. Best Teacher National Award in Shalakya Tantra PG, Dr. Nilakshi Pradhan Madam. Dr. Nilakshi Pradhan Madam, please come on the stage. Best National Award for Ayurveda Researcher, Dr. Jaykumar Ade, Assistant Professor in Priya Sharir, SGR Ayurveda College, Solapur. Wait for the light. Best National Ayurveda Researcher Award, Dr. Jaykumar Ade. Best Teacher National Award in Research Methodology. Best Teacher National Award in Research Methodology, Dr. Praveen Patil. Dr. Praveen Patil. Best Teacher National Award in Unani UG, Dr. Ansari Asif. Best Teacher National Award in Unani UG, Dr. Ansari Asif. Best Teacher National Award in Unani PG, Dr. Sheikh Ijaz Parvez. Dr. Sheikh Ijaz Parvez. Dr. Sheikh Ijaz Parvez, please come on the stage. Best National Ayurveda Dean Award, Professor Dr. Hemant Tosikane sir, Dean Ayurveda Faculty, Parul University. Professor Dr. Hemant Tosikane sir, Best National Ayurveda Dean Award. Best National Award for Leader, Dr. Ramdas Garje sir. Best National Ayurveda Leader Award, Dr. Ramdas Garje sir. Best National Ayurveda Sanhita Sevak Award, Dr. Ramatirth Sharma, Ujjain, Madhya Pradesh. Best National Ayurveda Sanhita Sevak Award. Best Social Work Award, Dr. Sandeep Tambare. Dr. Sandeep Tambare. Please come on the stage. Next, felicitation award goes to Dr. Professor Narayan Jadhav sir, Member, Board of Ethics and Regulatory, NCISM, Ministry of Ayush, Government of India. Dr. Narayan Jadhav sir, please come on the stage. National Sastrutya Yoga Excellence Award, Dr. Santosh Kamble sir. National Sastrutya Yoga Excellence Award, Dr. Santosh Kamble sir. Please come on the stage. Next, Best Emerging Teacher National Award in Sanhita Siddhanta, Dr. Ashwin Bagde sir. Emerging Teacher in Sanhita Siddhanta, Dr. Ashwin Bagde. Best Emerging Teacher National Award in Rachna Shari, Dr. Pawan Gulane sir, D.Y. Patil Ayurveda College, Pune. Best Emerging Teacher National Award in Dravya Gun Vignan, Dr. Chaudhary Vivek. Dr. Vivek Chaudhary. Dr. Pawan Gulane. Dr. Vivek Chaudhary. Best Emerging Teacher National Award in Swastrutya, Dr. Yogesh Shinde. Dr. Yogesh Shinde. डॉक्टर विवेक चौधरी, इमर्जिंग टीचर नॅशनल अवॉर्ड द्रव्य, डॉक्टर योगेश शिंदे, इमर्जिंग टीचर इन संस्कृत. Yes. बेस्ट इमर्जिंग टीचर नॅशनल अवॉर्ड इन शल्यतंत्र डॉक्टर स्मिता मोहळे. इमर्जिंग टीचर शल्यतंत्र डॉक्टर स्मिता मोहळे. बेस्ट इमर्जिंग टीचर नॅशनल अवॉर्ड इन कौमार नृत्यतंत्र डॉक्टर जितेश यादव ठाकुर. इन कौमार नृत्य डॉक्टर जितेश. बेस्ट इमर्जिंग टीचर नॅशनल अवॉर्ड इन युनानी डॉक्टर जावेद अहमद खान. डॉक्टर जावेद अहमद खान. Now we will move to the student section. Best student national award for PG Dr. Srijay TK, Pandit Taranath Government Ayurveda Medical College and Hospital Research Center, Ballari. Dr. Srijay. Best student national award UG Miss Dhande Prastuti Pramod. Miss Dande Prastuti Pramod, Mahatma Gandhi Ayurveda College and Hospital Research Center, Salod, Varta. Congratulations for all the awardees and thank you very much for the respected dignitaries on the dais. This award function is over now. I hand over this mic to the madam. Thank you. Thank you very much. Please be seated.
I request all the dignitaries. Our next program is book inaugural ceremony. Now we go ahead to inaugurate a book of Shalakya Tantra published by Shri Dhanvantari Book Publishers, and this book is authored by Dr. Sumedha Pundagi Kotangre, Dr. Yogesh Tukaram Kotangre. This book is on Mukha Roga Vidyan of Shalakya Tantra. So I'll request for this book inaugural ceremony. I request the authors of this book to come upon the dais for this inaugural ceremony. Dr. Yogesh Kotangre, Dr. Sumedha Kotangre, Madam. Thank you, Dr. Yogesh Kotangre. Thank you, Madam. Thank you, all the dignitaries. Please be seated. Now I'll request कोणतंही शास्त्र कुठल्याही शास्त्राला पुढे आणण्यासाठी राजाश्रय तितकाच आवश्यक असतो. क्षमा असावी, मराठीतून बोलतीये कारणच तसं आहे. सो हा राजाश्रय आपल्याला तिथल्या शासनाकडनं मिळत असतो. आज आपल्यामध्ये एक अत्यंत उत्तुंग व्यक्तिमत्व उपस्थित आहे. सन्माननीय आमदार श्री जयंत आजगावकर सर. मी सरांना विनंती करते की सरांनी आपल्याला 2 शब्दाचे अनमोल मार्गदर्शन करावे. सर.
आयुर्वेदा टीचर्स असोसिएशनच्या वतीनं या ठिकाणी चौथी नॅशनल कॉन्फरन्स आयोजित केलेली आहे. त्याचबरोबर नॅशनल अवॉर्ड्सही त्यांनी या ठिकाणी प्रदान केलेले आहेत. या संयुक्त कार्यक्रमासाठी गेल्या वर्षी मी आलो होतो कार्यक्रमाला, चालू वर्षी या ठिकाणी सरांनी सांगितलं यावं लागतंय. हक्क काय म्हणलं तुमचा, त्यामुळे 100% येणार, त्यात कुठेही थांबणार नाही आपण. तर या कार्यक्रमास उपस्थित VC ऑनलाईन होते, आपल्या प्रो VC निकुम सर या ठिकाणी उपस्थित, पाटणकर सर उपस्थित राहून गेलेले आहेत, डॉक्टर धर्माधिकारी आहेत, रानडे सर आहेत, डॉक्टर सौरीकर आहेत, या असोसिएशनचे प्रेसिडेंट आमचे मित्र सुरेश सर, सेक्रेटरी आमचे मित्र चौधरी सर, त्यांचे सर्व सहकारी, सन्माननीय व्यासपीठ, रानडे मॅडम आणि उपस्थित आपण सर्व प्राध्यापक, डॉक्टर्स. प्रथमतः ज्यांना अवॉर्ड्स मिळाले त्यांचं अभिनंदन करतो. खऱ्या अर्थानं आयुर्वेद वाढला पाहिजे हे सगळ्यात महत्वाचं आहे. कारण मला वाटतं ॲलिपॅथीपेक्षा सुद्धा भारतीय संस्कृतीने दिलेली ही मोठी देण आहे की आयुर्वेद. आणि आयुर्वेद म्हणजे असं आहे की त्याच्यामुळे आजार बरा होतोय, कुठला नवीन आजार उत्पन्न होत नाहीये. याला आपण म्हणतो साईड इफेक्ट्स निर्माण होत आहेत बऱ्याचशा औषधांना, परंतु आयुर्वेद असं आहे की ते आजार बरा करते, परंतु दुसरं काही निष्पन्न त्यातनं होत नाही. बऱ्याच वेळा या लोकांशी माझी चर्चा होत असते, पुण्यात ज्यावेळी माझी त्यांची भेट होत असते, खऱ्या अर्थानं त्या ठिकाणी यांच्या मागणी मगाशी सुरेश सरने आपल्या भाषणात मांडल्या की प्रत्येक जिल्ह्याला आयुर्वेदिक कॉलेज झालं पाहिजे. ज्या पद्धतीने MBBS कॉलेज गव्हर्नमेंटचं आहे त्याच पद्धतीनं आयुर्वेदिक कॉलेज झालं पाहिजे. यांच्या मागण्याही बऱ्याचशा आहेत. म्हणजे ते असोसिएट प्रोफेसरची मागणी असेल, महत्वाची जागा बाब असेल ती म्हणजे रिक्त जागा. कारण बऱ्याच वेळा मला वाटतं 2 वेळा आपण चौधरी सर, अमित देशमुख यांच्याबरोबर मिटिंग आयोजित केली होती, त्यांनी चांगला प्रतिसाद दिला होता. आताच्या काळात परत त्याच्यामध्ये जरा सरकार बदललं आणि आता परत मला वाटतं गिरीश महाजन या ठिकाणी यांच्याकडे सध्या तरी ती जबाबदारी दिलेली आहे. लवकरच त्यांच्या समवेत मिटिंग लावून मला वाटतं आता ते अंतिम रेषेवरती आपलं काम आलेलं आहे. जरासा धक्का दिला तर ते काम आपलं होऊन जाईल. आणि मला खात्री आहे की याच्यामध्ये जे आहे तुमच्या असोसिएटच्या प्रोफेसरची जागा म्हणजे पद असेल किंवा त्या ठिकाणी रिक्त जागा भरण्याची बाब असेल. कारण मध्यंतरीच्या काळात आम्ही त्या ठिकाणी विधान भवनामध्ये सुद्धा अधिवेशनात मांडलं होतं की कोरोना सारखे साथीचे आजार मोठ्या प्रमाणात निर्माण झाले. 2 वर्ष त्या ठिकाणी खऱ्या अर्थानं जर कुणी काम केलं असेल तर या आरोग्य खात्यातील लोकांनी काम केलेलं आहे. त्यामुळे यांच्या बाबतीतला म्हणजे आज सुदैवानं जर बघितलं तर आतापर्यंत कधीही वैद्यकीय विभागासाठी बजेट होत नव्हतं, तेवढं मोठं बजेट आता मात्र या भविष्य काळामध्ये त्या ठिकाणी या वैद्यकीय विभागासाठी केलं जातंय. नक्कीच मला खात्री आहे की या विभागालाही चांगले दिवस येतील, कारण आता आयुर्वेद सुद्धा चांगल्या पद्धतीने वाढलेलं आहे. मग सुद्धा मी रानडे सरला म्हणलं बऱ्याच वेळा किंवा पाटणकर सरनाही म्हणलं, याच्या अगोदर BMS डॉक्टर्स ॲलिपॅथिकच प्रॅक्टिस करायची. कारण बऱ्यापैकी ग्रामीण भागात आमचा संपर्क असल्यामुळं लक्षात यायचं की BMS झाल्यानंतर तात्काळ म्हणजे त्याच्यामध्ये डॉक्टरची चूक नाही, पेशंटला लगेच तात्काळ गुण हवा असतो. 1 दिवसात 2 दिवसात तो बरा झाला पाहिजे अशी परिस्थिती असते. आणि अशा वेळी मग ॲलिपॅथिकचा वापर केला जायचा. परंतु आता जर बघितलं तर एक चांगल्या प्रकारची जागृती समाजामध्ये झालेली आहे की त्या ठिकाणी पंचकर्म आणि हे वाढायला लागलेलं. फक्त एकच आहे की हे म्हणजे गरिबाला हा जो उपचार आहे तो जरा खर्चिक असल्यामुळे त्या ठिकाणी बऱ्यापैकी अजूनही हा प्रसार वाढला पाहिजे. आणि हा वाढण्याची जबाबदारी मला वाटते मगाशी पाटणकर सर म्हणले तसं या आपल्या आयुर्वेदिक डॉक्टरांचीच असणार आहे. आणि ह्यासाठी गव्हर्नमेंटला सुद्धा त्या ठिकाणी आम्ही जास्तीत जास्त हा प्रसार वाढवण्यासाठी सक्रिय होणं आपण त्या ठिकाणी करू. कारण आयुष मंत्रालय जाहिरात मोठी झाली आणि त्या तुलनेनं त्याचं काम तेवढं होऊ शकलं नाही.
ज्या तुलनेनं जाहिरात होती त्या तुलनेपेक्षाही जास्त काम त्या ठिकाणी झालं पाहिजे या अर्थानंच आपण बघतोय. कारण आता या कोरोनानं दाखवून दिलेलं आहे बऱ्याच वेळा. कारण मी आता काही बऱ्याच वेळा आमचा प्रसंग येतो लोकांना भेटण्यास हॉस्पिटलला जाणे किंवा मयत झालेल्या लोकांना. तर 7 महिने 8 महिने म्हणजे परवा तर एक पेशंट मी कोल्हापुरात असा पाहिला की 8 दिवस ऍडमिट झाला. त्याच्या त्या आतड्यामधील रक्तवाहिन्या त्या कोरोनामुळे चोकअप काहीतरी झाल्या आणि आतड्याला होल्स पडली आणि त्यातच त्याचं दुःखद निधन झालं. म्हणजे हा प्रकार जो होतोय ह्याला खऱ्या अर्थानं मला वाटतंय जर कोण फाईट करू शकेल तर ते आयुर्वेदच करू शकेल हे मला खात्रीशीर वाटतंय. आणि मला वाटतंय हा प्रसार आपण वाढवू. या निमित्तानं पुन्हा एकदा ज्यांना म्हणजे ज्यांचा सन्मान झाला सत्कार झाला त्यांचं अभिनंदन करतो. आणि ज्या मागण्या आपल्या राहिल्या आहेत तो तुमचा विभागाचा आमदार या नात्यानं आपण 100% पूर्ण करू एवढीच या निमित्तानं ग्वाही देतो आणि थांबतो. आणि जरासं मला जायची परवानगी मागतो. धन्यवाद.
धन्यवाद सर. आपलं बहुमूल्य मार्गदर्शन नक्कीच आमच्यासाठी प्रेरणादायी आहे आणि आयुर्वेदाला नक्कीच हा राजाश्रय खूप खूप आवश्यक आहे. पुन्हा एकदा धर्मार्थ आयुर्वेद औषधालय अनेक मोठ्या प्रमाणावर सुरू व्हावे. May I request to all the awardees to please come up on the stage for a group photo along with the dignitaries. सर्व मान्यवर विजेत्यांना विनंती आहे की त्यांनी व्यासपीठावर यावं. All the dignitaries are requested to come upon the stage for a group photo along with the dignitaries. विजेत्यांचे अभिनंदन आणि मान्यवरांचे आभार. I request all the dignitaries to please be seated. I request all the dignitaries to please seated on their places. Moving forward for the program, we are already lagging behind. So I request Dr. Sriram Savrikar, sir. So for your valuable guidance, sir, please.
Dignitaries on the dais, I know it's very late now. I will not be taking much time. 5 minutes I will speak just actually 2 minutes only, as Dr. Ranade has. Fine, okay. Dignitaries are Dr. Ranade, sir, Mrs. Ranade, the president of this association, Dr. Suryavanshi, Dr. Manoj Chaudhary, all other members, dignitaries, the officiating members, and students and teachers also. My friends, this is very late. I can't speak much. Very late, actually, it is 2:30 almost. We are, I think, 2 hours late. So I just congratulate everybody who has received this award, and I also congratulate the association for doing a marvelous job. Dr. Chandrakar, your name I forgot. But you are doing a very marvelous job. You are giving impetus to the work of each, including the students also. Young teachers also. That's a good thing that you have emerging teachers also. You are giving awards. So keep on doing such a job, and we are always with you. Whenever you want anything from us, we will be supporting you. Thank you very much for giving me a.
Thank you so much, sir. Sir has really briefed his thoughts within 2 minutes only. Thank you. Thanks again, sir. Now I'll request Honorable Pro Vice Chancellor, Maharashtra University of Health Sciences, Dr. Milind Nikumba, sir, for his address.
माझ्या मते सर्वांनी बसून घेतलं तरी काय हरकत नाहीये. 2च मिनिटात संपवतोय. सन्माननीय व्यासपीठ, आज ज्यांना आपण जीवन गौरव पुरस्कार दिला त्याचे मानकरी डॉक्टर सावरीकर सर, त्याच्यानंतर उपस्थित सर्व गुरुवर्य रानडे सर, ज्यावेळेस आम्ही आयुर्वेद कॉलेजला दाखल झालो त्यावेळेस रानडे परांजपे सोडून दुसरं कुठलंही पुस्तक नव्हतं अवेलेबल. त्याच्यामुळे आम्ही सर्वच रानडे परांजपे म्हणजे थोडक्यात रानडेंचे शिष्य आहोत आणि त्यांच्यामुळे आम्ही आयुर्वेद शिकू शकलो. धन्यवाद रानडे सर. सर्वात महत्त्वाचं म्हणजे आज विद्यापीठ इंटिग्रेटेड हेल्थ आणि इंटरडिसिप्लिनरी आपण रिसर्च वर्क यासाठी प्रयत्नशील आहे आणि माझ्या मते सर्व टीचर्स असोसिएशन तर्फे किंवा नुसतं असोसिएशनच नव्हे तर सर्व टीचर्स तर्फे सर्वांनी याच्यामध्ये सहभाग घेऊन या आयुर्वेदाला फक्त महाराष्ट्रातच नव्हे तर आपल्या अख्ख्या जगामध्ये वर आणण्याचा प्रयत्न करावा आणि यासाठी सर्वच टीचर्सने प्रयत्नशील राहावे आणि जास्तीत जास्त पेटंट या असोसिएशनने मिळवून दाखवावे जेणेकरून सर्वांना असं जाणवेल की आयुर्वेद असोसिएशन फक्त नावालाच नसून सर्व क्षेत्रामध्ये प्रवीण राहील आणि मी त्यांना शुभेच्छा देतो. धन्यवाद.
धन्यवाद सर आपल्या बहुमूल्य मार्गदर्शनासाठी. थँक्यू सर. थँक्यू सो मच. Now moving forward towards the end of this program. सत्कारांचे भार कशाला आभाराचे हार कशाला, सत्कारांचे हार कशाला आभारांचे भार कशाला. So moving towards the end of this session, and now I'll request Dr. Anand Madgundi sir, member of Ayurveda Teacher Association, for the vote of thanks of this program.
Thank you, ma'am. Good afternoon, all. I'll just complete the vote of thanks in short words. Myself, Dr. Anand, you are expressing vote of thanks on behalf of ATA. It's my privilege to have been asked to propose a vote of thanks on the great moment of this national award ceremony. First of all, I would like to thank today's chief guest, Dr. Honorable James Askawkar sir, MLC, for his presence and making the moment memorable. Extend thanks to Dr. Madhuri Kanetkar Madam, Vice Chancellor, MHS Nasik, who could not be present due to her busy schedule for administration, but shared by virtually presence and sharing some valuable words. I also thank Dr. Medin Nikum sir, Pro VC by MHS, for for being here and giving his valuable time and guidance. Like to thank Dr. Suresh Patankar sir also, Member Management Council MHS Nasik, for his presence and sharing his words. I would like to express my gratitude to Dr. Dharmadikar sir, Assistant Director of Pune, guiding us to make this session successful. I would like to thank Honorable Sri Ram Savrikar sir also, the great person of Ayurveda, who always shower his blessings and guidance for our association and being here. Thank you, sir. Now I would like to thank respected Dr. Hemlata Jalgaonkar Madam, Principal, Ashtanga Ayurveda Mahavidyalaya, Pune, appointed as observer for this 3-day national conference and mentoring and guiding for since 3 days. Next, I would like to thank to all the eminent speakers sharing their innovative thoughts and giving immense knowledge throughout 3 days for this national conference. Then I would like to thank all the chairman, co-chairman, session coordinators who made this session successful without any inconvenience. Thank to all of them. Now I would like to take the opportunity to thank all the committee members of the ATA who are working since last few weeks to make this event successful. Without them, it could not have been possible, especially the paper presentation committee, which have done a great job in spite of lots of presentations entries. I would like to thank the registration committee across the world who worked hard for the registration and conveying with the delegates to make this event last. I would also like to thank the associate associations, Arogya Bharati, NIMA, Ayurveda Maharashtra, Nasya India, BMS Graduate Association, Maharashtra Association of Ayurveda Students and Doctors, Ayurveda Vyaspeeth, Vishwa Ayurveda Parishad, Ayurveda Sammelam, Shalaki India, Kashyapi Ayurveda Gynecology and Obs Foundation for their valuable support. I would like to thank all the delegates, paper and poster presentations who participated online and offline, making this conference a grand successful. Now, I would like to thank all the technical committees, members, support staff, catering committees, and all the rest for their providing their services. Now, last but not the least, I would like to thank our media partner, DigiShield, to their excellent coverage for this event. Thank you, thank you. Now, with the permission of the Honorable Dais, now with the permission of the Honorable Dais, I declare this award ceremony is over. Thank you. And I request all the chief guests, respected persons and delegates to have delicious lunch, which has been arranged on the first floor of this hall. Thank you. So 1 minute. Sir, excuse me. Thank you. Now I request all the dignitary dais and the delegates in the hall for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल वंग विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंग तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे भारत माता की वंदे धन्यवाद।